We will reconvene. Okay, thank you very much. We now move on to item number 24, advancing equity through an ad hoc subcommittee on safety net services and behavioral health systems transformation. I'm very excited to bring this forward with my colleague, Vice Chair Montgomery Stepp. Would you like to make any introductory comments?
Yeah, I'll go ahead and make a few. Thank you for partnering again on this item with me. And we've talked a bit already about HR 1 and trying to mitigate its impacts. I believe this board letter is in line with that. So in December 2024, I directed the board to begin exploring strategies to strengthen behavioral health services' role as a health plan. A lot has changed since then. HR 1, the so-called One Big Beautiful Bill, Act has increased the urgency, and there is urgency, for this board to rethink how we administer Medicaid and other public benefits. Departments like BHS must be nimble and adaptable to the rapidly changing federal landscape. While HHSA and BHS are interconnected, HR 1 creates significant new administrative burdens that require streamlined and specialized oversight. Today, BHS accounts for roughly 1/3 of the entire HHSA budget. It manages highly specialized Medi-Cal mental health and substance use services, but still remains nested within a much larger agency. Elevating BHS to a standalone department will allow the county to track funding, outcomes, and accountability more directly. It will allow the county to be more efficiently more efficiently administer these important programs at a time of heightened urgency in the wake of HR 1, when our most vulnerable community members face the most need. I don't think that we can afford to wait for this type of change and structural change within the county by strengthening behavioral health services and building a more resilient social safety net. We can ensure that no one falls through the cracks. This board has a responsibility to act decisively to help San Diego County meet this difficult moment, and I urge the board to support this item. I will turn it back over to the chair.
Thank you very much. I'll say a couple comments, and then we will go to public comment. Just to echo my colleague, we're at a crossroads right now. One is the federal shift, and I think we've talked a lot about that, and we'll continue to engage on that. And another is local. And in the first shift that we've been continuing to grapple with is the HR 1 and whatever might and most likely will emerge in the fall regarding the budget, the federal budget. And these are the safety net cuts that we're staring at. The work requirements, the redeterminations, all the procedural hurdles, which if we don't take aggressive action and we don't bring a real strategy to bear regarding eligibility, is going to result in thousands and thousands of people losing Medi-Cal, CalFresh basic supports, really frankly due to bureaucratic red tape and procedural hurdles that have nothing to do with actual eligibility, just has to do with additional paperwork. And I think this is something we've talked about on this board many, many times, is trying to make government more efficient and more streamlined, and we're going in exactly the opposite direction with what's coming down to us from the federal government. And the hardest hit folks are going to be low-income families, communities of color, people with disabilities, LGBTQ plus residents. And in this moment, our job is very clear. Our job is to defend access to healthcare, to food, to basic benefits, to inform residents of their rights, and work across sectors so people are not left behind. The second shift, which we are going to speak more about later today and has been a core focus of this board's work over the last 4 years, is the restructuring of behavioral health services and the expansion of treatment capacity to improve coordination, to really be able to provide care before people are in crisis. Instead of waiting until people are at their absolute lowest point, to engage earlier when it's more cost efficient, more cost effective, to get people the help that they need when they need it, instead of waiting until people spiral, sometimes beyond what anyone can do to be helpful, and certainly ending up often on our streets. So the purpose of this board item is to tackle these two issues head on. We're going to be proposing to create an ad hoc subcommittee on social safety net and behavioral health transformation that can really dig in on our HR1 response, guide the transition of BHS, and ensure that the broader community's voices are heard as we undertake these administrative and organizational shifts that are necessary to respond to the crisis that we face in our community. So I would say what I think is most important about the item today is that I think often we end up being very reactive. And the goal here is to look ahead, to be proactive, to make a plan, and to lead so that we're in position to help people get the help that they need instead of being left behind. So that's why I wanted to bring this to my colleagues' consideration today, and I look forward to a robust conversation. So with that, would like to take public comments.
Thank you, Chair Lawson-Remer. We have 13 requests to speak on this item, 5 in person and 8 requesting to speak by phone. Also note that we received 1 e-comment in support. For any individuals that requested to speak on item 24 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please come forward and stand on the arrows until it is your turn to speak at the podium. Because there are 10 or more speakers on this item, you will have 1 minute to address the board, and I'll ask you to please begin by stating your name for the audio record. I'd like to invite forward the first 3 individuals, Consuelo, Clayton Fowler, and allegedly Audra.
Good afternoon, Chair Lawson-Remer and members of the Board of Supervisors. My name is Clayton Fowler, speaking on behalf of the Downtown San Diego Partnership. We want to thank you for making behavioral health a top priority. As you know, our urban core serves as the region's economic and cultural hub. However, we continue to experience the most visible impacts of the behavioral health crisis, namely around untreated mental illness and substance abuse. Every day, our downtown residents, workers, and visitors, and our own unhoused care team witness the gaps in our behavioral health infrastructure and lack of county emphasis downtown. We urge this ad hoc committee to prioritize proactive behavioral health outreach that engages individuals directly on the street before episodes of crisis escalate, and emphasize the need for diversion strategies like conservatorship and investments into long-term psychiatric care facilities for those with the most acute needs. The Downtown Partnership is committed to being a partner in this work, and we invite each of you to tour our urban core with our outreach team and see the.
Thank you. Next speaker, please.
Yeah. Okay. Okay. Shit. Okay, Consuelo here. Let's see. This item is about advancing equity through an ADHOC committee on safety net services and behavioral health system transformation. Okay, but let's call it for what it is. This is the design. The endless spiral of struggle is exactly what government lives for. There are no accidents that it's always lower income families labeled people of color at the center of these policies. That's division by design. And what does government provide? Medicaid, food programs, behavioral health, always subpar. Never meant to solve, never meant to heal, only to keep the problem alive. This isn't transformation, it's maintenance of control. Humanity must wake up because this system will never be the solution. That's it.
Thank you. I'd like to invite forward the remaining speakers in person, Mark and Joshua Bohannon.
Hi, Board of Supervisors. Josh Bohannon with Father Joe's Villages. We operate self-sufficiency programs, but we also do behavioral health care as well. And this issue is really too large for one entity, one organization to manage itself. I think nonprofits and providers and members of the community have a different perspective in understanding how your policies are implemented and how they're actually executed in the field. So I applaud this effort to create that community input, to take a larger coalition of people to hear that perspective. For example, at Father Joe's, we just built a 44-bed detox facility, but it took other drug treatment providers, the hospital systems, the state, the county, everyone just kind of helping to understand what is the best approach for the community and to meet that need. So if we were going it alone, I don't think we would have developed something that we have created, and it was that community collaboration that made a difference. And we just received notice that we will have our license in a few weeks. So we're about to bring 44 detox beds, thanks to the community coming together to help us build it.
Thank you. Next speaker, please.
Mark, well, you're certainly not going to stop inflation caused by the Federal Reserve. People need to see this video YouTube title from 6 minutes, 40 seconds to 24 minutes. And I'm sure you're just going to do your, oh, by the way, I had to see this whole video. This is a documentary on when I was young. Wealth Inequality in America, 6 minutes. I know you're not going to stop your 18,000 people doing LPS conservatorships on homeless. They're made homeless by the Federal Reserve intentionally through inflation. And they'll be able to drug them against their will, simply for being made poor by the Federal Reserve, a lot of them. That can really make someone mentally ill, too, the stress. Rosa Corey, see this? California recognized expert court witness for the Department of Transportation. See it from 3 minutes and 30 seconds. There are some times on Rosa's first two parts for you. See this? About Agenda 21. If you don't believe it, see Klaus Schwab in 1 minute saying that he's penetrated governments, including Gavin Newsom, young global leader for the World Economic Forum.
Thank you. Next speaker, please.
You guys, in your anticipated need for behavioral health workers, it's quite interesting because you guys want to change behaviors of people so that you can medicate them and spend our money on it. And people like Kimsey over here who take children away from their families, then make them go through a behavioral health evaluation so they can be put on psychotropic drugs because they are having a hard time being separated from their parents over and over and over and over over and over again, and you wonder why they are throwing temper tantrums because they want to be near their family. So that's the kind of behavioral health services that you give, Kimsey. You don't give it to help people. You guys actually torment children and put them on behavioral health medication because they are having a hard time being ripped apart. How would that feel, Tara, if that was your fucking daughter? Ripped apart from you, and they put her on fucking psychotropics because of it.
We'll now hear from those that requested to speak by phone. We will start with our first caller.
Hi, Paula Bold. I don't think we can wait on the cassette, I think. Is this some kind of ad biz? Not many details either. Not sure why there's links changes to Medicaid and nutritional programs with the realignment of the behavioral health system, HS, into a standalone department. HS uses many of the same resources as a hospital, so that BHS and other medical services belong in the same organization. Sounds like the county wants to treat all mental cases up front rather than a few after the breakdown. Big waste of money. Another proposal based on old data. The financial summary says funding will be based on the redirection of amounts set aside for the December.
Thank you. Hear from the next caller.
You're completely wrong with that statement, by the way. I just wanted to prove a point that you cannot stop me from talking like you do arbitrarily all the time. And thank you, Monica, for bringing that up. Yes, I do definitely understand the meaning behind that word. And thank you for bringing up treating someone like they don't exist. How many phone calls have you returned of mine? I asked you about Jamal Brown, the guy that's basically recycling plastic, and that would get everyone excited about recycling plastic so that we don't end up with mountains of debt. Young 21-year-old kid, 21-year-old Jamal Brown. He went missing he had to go missing because people are after him. We could support him and protect him, but you choose not to. So yes, you are what I said you are. There's no question about it. And there is no hiding from it. Unless if you want to address that, if you want to call me back and you treat me like I do exist.
For the record, that speaker was identified as Gambler Hermes. We'll hear from the next caller.
Hey, it's Truth. Why does the county's BS program need to be a standalone organizational structure versus a program? Is this profit-driven to profit off locking up and drugging homeless people and justify increasing the size of the government by 18,000 purple shirt workers? Remember when y'all wanted to raid the reserves to make big money with a monopoly backroom deal with UCSD? Who even did the consulting services and how many tax dollars are wasted on that? Now you guys are claiming this needs a governance framework. Is that an admission that this program is operating outside of the normal government framework? It's almost like TDS is being used as an excuse to funnel money to pet projects to cover up the county's 23% increase in homelessness, despite having thrown billions at the problem. What needs realignment and reorganization is these supervisors' consistent bad policy decisions. Tara and Monica on a $400,000 ad hoc is just more of an expensive witch's brew towards disaster. How could Monica make a decision on overlapping systems when she's claimed systems are the problem? This is the system you complain about. Money grabbers lined up with their hands out to exploit the county's poorest. Shame. Shame on all of those who do that.
Thank you. We'll now hear from the next caller.
Hi, yes. I am supposed to be speaking on item 25, so I think I have to wait.
Thank you. We'll call you when that item comes back. We'll hear from the next caller.
Good afternoon, Board of Supervisors. This is Ann Riddle. I called in to address item 24. because I work in the nonprofit sector, and I'm well aware of what $400,000 would buy in youth programs. So I'm asking, what is the product we're going to receive from this $400,000 that will go into this ad hoc subcommittee? I think it would be, in these financially oriented times, wise to explain it more efficiently to all of us who live here in the county, how this money is going to be used. The words don't give us any product. They just talk about a coordination goal that we'd all agree with, but you need $400,000 to do it. That's a surprise. And I also wonder about the choice of the two supervisors to be on this committee. Would it be wiser for it to be Supervisor Aguirre and Supervisor Anderson, since they have the county designated areas that are the most poor?
Thank you, Chair Lawson-Remer. That concludes public comment on this item.
Thank you very much. So if my colleagues have any comments, Supervisor Desmond?
Madam Chair, appreciate it. I don't have a problem with trying to, do better with behavioral health systems and things like that, but ad hoc subcommittees I don't agree with, especially with ongoing goals and without a specific ending. During COVID, we had an ad hoc subcommittee, and we had a specific date on the end of it, but the rest of the board ended up finding out what decisions were made on the media, on the news that night. So I do agree that behavioral health services should be separate from Health and Human Services. They have a unique role in the county as a health plan, and we should do whatever we can to set them apart for success. But the ad hoc subcommittee, the CEO and the department heads, they work with all five of us, all five supervisors. And I think this is getting supervisors too far into the weeds, into the inner workings of the county. We're the policymakers, not the department advisors. We're not the experts at this. We're not the professionals who know best how to run these departments. And I don't agree with the ad hoc because it doesn't have a finite time frame or a narrow purpose. It's required by state law that ad hoc subcommittees have a defined purpose and time frame to accomplish that purpose. And the purposes be presented here, I mean, they're nice, but they're just very broad and ongoing. One of them says advising, one of the purposes is advising on organizational realignment opportunities that improve transparency, fiscal stability, and service effectiveness across county health and human services systems. So this is advising. So when does the advising end? There's no end date. When does, after you give advice, is it over? Is it done? Or is this ongoing advice that's going to be given by the ad hoc committee? Another purpose is exploring technology. That's good. And data solutions to streamline enrollment and case management and reduce barriers to access. So without a specific date or an ending, when does the exploring end? And there is noted that once these purposes outlined have been achieved, the subcommittee will conclude its work. Well, how do we know when the exploring has been achieved? There's no real definite end there. So, I think decisions being made by 2 of the 5 board members behind closed doors is not the best way to go about this. This should be a regular, if you want to do it, be a regular subcommittee. A regular subcommittee so that Brown Act applies and these decisions are more transparent. They're made with public participation. They're out in the open. So I'm not going to be supporting this primarily because of the ad hoc committee and its structure. And to me, these goals are not definitive or specific for ending. So thank you.
I just want to take a moment to respond to those questions from my colleague. I do want to clarify that it is pretty clear when the work would end. The way that you read it was drawing from sub-bullets as opposed to overarching bullets. So you have to look at the overarching bullets to understand what the work scope is. It is important to have clarity of what the scope of work is, and it does have pretty definitive deliverables. So the first one, right, is...
Where are you in the board letter? Because I'd like to see this.
Yeah, we're on number 1. So if you look at number 1, so what you were looking at were the sub-bullets that were the aspects of the bullets. which I can acknowledge might lead one to believe the work is ongoing, right? Advising, but you have to kind of look up a level. You were in like a B.1, B.I. You got to look at B and not B.I. So, the work that we're being charged with is A, developing a coordinated countywide response to federal changes in eligibility systems. B, transforming the BHS department into a distinct organization. C, assessing the potential operational equity impacts of federal policy changes. And so then the pieces that you were quoting were the aspects of the work that goes into A, B, and C. It's not the work itself. So just want to make sure that that was clear for folks. So the charge of the subcommittee is really A, B, and C. And then within each of those, there's like elements of what's required in order to accomplish A, B, and C, but A, B, and C are the purposes that have been outlined above. And once those have been achieved, the subcommittee would conclude its work. So I just wanted to note that. And I do appreciate a couple of things. I do want to acknowledge and appreciate my colleagues' concern about the operation of the COVID subcommittee that did not report back in a timely way. And certainly, I think we've made it a practice since then to really be significantly more accountable to this board and reporting back. And that would certainly be my commitment here. I think that's really important. And, we do need to continue doing that. I do think there's a significant difference between the scope of work of this committee versus the COVID subcommittee. The COVID subcommittee was making decisions in real time about how to respond to COVID, and then letting the board know, way after the fact, what decisions were made. This is very much supporting the CAO to put a plan together, and before that plan is implemented, would have to come back to the board in any case for approval.
Okay.
So
well, I
just wanted to make sure that was clear. But I do also want to appreciate, I think it sounds like we're all on the same page, at least on the very core piece of this, which is pulling BHS out of I think we're clear. We're in agreement on the what. I think there might be a little disagreement on the how, but I think that's helpful, at least for staff to hear, that there's the how. We might not agree on how we get there, but I think we all agree. We all, at least so far, seem to agree on the what. But I'm looking forward to hearing from my other two colleagues.
There are three purposes you still. One of them is developing, the other one's transforming, and the other one's assessing. So there's really no. How do you know when you've transformed behavioral health services into a distinct organization? It seems like these.
I would know that it's transformed into a distinct organization once it's a distinct organization. That seems like a very clear.
Well, how do you know it's done? Okay, and initiate multi-year
just to be clear, it's through the budget, right?
It's still too vague for me.
It's okay. I don't need to convince you. I just wanted to make sure it was clear for the record that we have put a lot of thought into this, right? Like something's a distinct organization because it's a budget line item. It's very clear legally when that has occurred. But in any case, let me just turn to Supervisor Aguirre to make some comments. Oh, Supervisor Montgomery.
Just in response, Supervisor, understood and hear you. On one of the last ad hoc committees around Medicaid, we did regularly report back to the board, and that would be my intent. I just wanted to say that. I understand you may not support this fully, but I just want to say that publicly. Thank you.
Mm-hmm. Thank you. Supervisor Aguirre.
Thank you, Chair. I want to lend my full support to the two of you being part of this ad hoc. I have full trust that you will do the work that needs to be done. You've already been doing it, and that's why we have this item before us. So thank you for that. I also want to take a moment to talk about a misconception regarding Medicaid, food stamps, and other benefits. Usually people are called, these folks are called lazy. And are told that they refuse to take a job. A lot of people see them as fraudsters and taking advantage of the system. And I just want to set the record straight that that is not the case. There's plenty of evidence to the contrary. In fact, the Center on Budget and Policy Priorities performed an analysis of federal data and found that 91% of benefit dollars from entitlement and other mandatory programs go to the elderly, people who are seriously disabled, and members of working households. So these folks are just trying to make ends meet. And we need to stop letting these myths about welfare fraudsters, which are born out of racism and prejudice, continue to influence our policy decisions. So these programs are vital in pulling seniors, children, and working families out of poverty and helping them meet their basic needs. So I just want to, again, reiterate my support for this item. We need to meet this moment. We need to do it right, because as someone earlier this morning was saying, there's a lot of people falling through the cracks, and we can simply not allow that to happen. So thank you.
Thank you very much. Supervisor Montgomery-Stipp, would you like to make a motion, or I can? Okay, happy to make a motion.
Second.
Thank you. We have a motion on the floor and a second. Any other comments from anyone? Okay. With that, we will take a vote.
Chair Lawson Remer, that motion passes with Supervisor Anderson and Supervisor Desmond voting no, all other supervisors being present and voting aye.
Okay, thank you very much. We're moving on to item 25, receive an update on substance use disorder optimal care pathway model, authorize and adopt a resolution to apply for the bond behavioral health continuum infrastructure program, et cetera, et cetera. Ebony, I think we have a presentation.
Good afternoon, Chair Lawson-Remer and members of the board. Last March, we introduced you to the Substance Use Disorder Optimal Care Pathways Model, or SUD-OCP model. The SUD-OCP model builds on the original mental health OCP model from 2022 by identifying additional capacity needs to improve care pathways for people with a substance use condition. We're excited to provide an update on the significant progress we've made in alignment with the SUD-OCP recommendations. We've expanded capacity in 3 of the 4 key areas identified for care. Behavioral health services has upcoming opportunities for additional funding to continue to build capacity in our continuum of care and updated agreements that support full implementation of payment reform. With me today are Nadia Pravara, Acting Behavioral Health Services Director, and Dr. Nicole Esposito, Chief Population Health Officer for Behavioral Health Services. I'll now hand the presentation over to Dr. Esposito.
Thank you, Kim. To level set, I'll start with the statutory role that behavioral health services plays in the county as a managed care plan. This graphic shows the range of services we offer and the populations we serve. Our primary membership group in orange are people enrolled or eligible for Medi-Cal and who have a substance use disorder, a serious mental illness, or both. But we also support broader groups like Medi-Cal beneficiaries shown in the middle blue circle and all San Diego County residents, which is the largest green circle. This is because the earlier we can reach people in their health journey, the better chance we have at connecting them to care before they reach crisis. For today's update on the SUD-OCP model, we'll be focusing on the innermost orange circle. In 2023, about 2 in every 10 people aged 12 years and older in the United States needed treatment for a substance use disorder. Substance use disorder is a chronic condition which requires ongoing treatment and supports to manage. It's similar to how someone manages their diabetes or hypertension, and substance use challenges often put a strain on a person's family, support systems, and their surrounding community. The cycle of addiction, hesitation to treatment, and even the stigma of receiving treatment can prevent people from seeking the care they need. Despite how common substance use disorders are, we still lack a system that effectively identifies, engages, and keeps people in treatment long-term. This is where the development of the SUD-OCP model comes in. The SUD-OCP model outlines the ideal capacity of substance use treatment and housing needs by 2030. It uses both local and national data and best practices to inform recommendations. It also incorporates estimates of how demand for services would increase if we were able to implement changes in how we reach individuals in crisis and thus break the cycle to prevent future hospitalizations, justice involvement, and mortality risk. The SUD-OCP model also responds to the unique challenges of substance use through an approach that is client-centered, community-based, and grounded in evidence-based practices. The model's recommendations align with existing federal benchmarks called Healthy People 2030. which are data-driven national objectives for health and well-being, including specific national targets for increased access to substance use treatment. Based on the SUD-OCP model, Behavioral Health Services has been building substance use treatment capacity across 4 areas to ensure people have access to the care they need. They are transitional support, residential care, outpatient care, and housing resources, specifically recovery residences for this model. We have significantly expanded capacity across our substance use care continuum since fiscal year 2021. But we still have a long way to go to meet our 5-year capacity goals under the SUD-OCP model. The figures in the far right column represent the annual number of people we need to serve by 2030. And while the increases are significant, we have already made great strides towards achieving the 5-year goals. I'll now hand the presentation over to Nadia to provide updates on these efforts.
Thank you, Dr. Esposito. The first category, transitional support, provides short-term care for adults who don't need to be in a hospital, but need additional supports to recover and return to the community. This category includes recuperative care beds for Medi-Cal beneficiaries with both serious behavioral health conditions and complex medical needs who need to transition from a hospital setting to a lower level of care. When we first shared the SUD-OCP model with you, there was no additional capacity within the service line. But over the last few months, we've made a lot of progress. 16 recuperative care beds will be located in this county-owned substance use residential and treatment services, or CERTS facility, following its completed renovation in summer of 2026. In addition, 25 new recuperative care beds came online in the North County in July of this year, and 8 more will come online in the East region in the fall, for a total of 49 new recuperative care beds. We're also in the planning stages for new peer crisis respite services, in which peers provide short-term, trauma-informed residential support for people in crisis. We will return to the board with future recommendations on this service. Under residential care, we are expanding capacity of residential treatment beds. Residential beds are clinical treatment settings that provide a safe, supportive environment for people to live while they work on reducing their use of drugs and alcohol. We will add 73 residential treatment beds within the CERTS facility that will be funded through a $21 million infrastructure grant awarded in round 1 of the Bond Behavioral Health Continuum Infrastructure Program, or BCHIP grant. 3 other local community-based organizations were also awarded BCHIP grant funds that will establish 150 new residential treatment beds, and we are thrilled to partner with them as projects near completion. The third area, substance use outpatient care, includes community-based treatment and recovery services. Last fiscal year, we increased access to medication-assisted treatment, or MAT, and ambulatory withdrawal management, or AWM. MAT combines the use of medications, counseling, and therapeutic interventions to treat substance use and prevent opioid overdoses. We added 4 new MAT providers for a total of 10 sites, with 7 others providing linkages in the community. And we want to make MAT services available at most outpatient sites by the end of this fiscal year. AWM helps people safely withdraw from substances in a supervised outpatient setting. These are often called detox services. However, these specific services are provided in a clinic and not in a residential setting, and are different from the residential detox beds. We increased AWM capacity by over 200% by adding over 500 new slots, and we plan to add 440 more over the next year. We also added 100 new narcotic treatment program slots, which combines behavioral health therapy with MAT to people with an opioid use disorder. Lastly, 3 local entities were also awarded BCHIP grant funds that will add over 2,000 new outpatient treatment slots. The last category is housing resources, which are linkages to housing for people with substance use conditions. We continue to need capacity for recovery residences. Recovery residences provide housing while promoting sobriety for people enrolled in substance use outpatient treatment or recovery support services. The board has supported expanded access to recovery residences through previous approved funding. From March 2024 to April 2025, more than 3,100 Medi-Cal beneficiaries have been able to connect to housing. And with the implementation of Behavioral Health Services Act next July, we'll have a new funding stream to sustain and grow recovery residents' capacity. With the planned additions across the 4 domains, including the new capacity from the BCHIP infrastructure grant funds, we will be able to make significant progress towards achieving the 2030 capacity goals. Annually, we anticipate serving 195 clients within transitional support through the new recuperative care beds, over 1,600 more clients through residential care, and nearly 2,500 more clients within outpatient services. And within housing resources, we are awaiting full guidance and will continue analyzing forthcoming opportunities for recovery residence slots through BHSA. To achieve the 2030 SUD OCP capacity goals, we need to continue growing partnerships and pursuing funding opportunities. In July 2023, we implemented behavioral health payment reform as part of the behavioral health transformation under CalAIM, which has allowed for higher reimbursement rates for our substance use providers. Payment reform will also allow for us to support capacity growth through reinvestment and care incentives in the future. To build infrastructure, we will submit an application for round 2 of the Bond BCHIP grant due this October. We are working with the Department of General Services to explore a behavioral health wellness campus on the vacant health services complex site on Rosecrans Street, and we will provide more information once details are solidified. Today, we are recommending the board approve the submission of the grant application and adopt a resolution required for BCHIP round 2. In recommendation 4, we are requesting the board to approve expansion of the scope of behavioral health bridge housing grant funds to include short-term bridge housing. Although this service is not part of the SUD OCP model, there are immediate capacity needs within our continuum, including for people living with a substance use disorder. Short-term bridge housing will give them stability and better access to treatment. Broadening the use of the grant funds will give us flexibility to maximize use of funds by June 30th of 2027. We also need to ensure maintenance of the existing network of care. The 5th and 6th recommendations today request the board approve updated agreements with the State Department of Healthcare Services to support the delivery of mental health and substance use services. And lastly, to align with the implementation of Senate Bill 43, we are recommending the board authorize the behavioral health director or their designee to develop and update procedures for designating and training professionals to carry out involuntary behavioral health holds. This will optimize operations and improve the flow of patients from emergency departments to treatment settings. In closing, today's actions request the board to receive the update regarding the SUD OCP model, authorize the submission of the Bond BCHIP Round 2 grant application and adoption of its authorizing resolution, authorize the expanded use of behavioral health bridge housing Round 1 grant funds to include short-term bridge housing, approve and authorize 2 agreements with the Department of Healthcare Services to be executed, and lastly, authorize the Behavioral Health Services Director or their designee to develop and update procedures for the designation of professionals who can place involuntary holds. Thank you. This concludes our presentations. We are available for questions.
Okay, thank you very much. Before we turn to public comment, do my colleagues have any questions?
I do.
Supervisor
Thank
Desmond.
you. Well, thanks for the presentation, and it's great to see all the new beds and new facilities coming online. On the recovery residences, I just wondering, I forgot there was a term you used as far as sober living.
Yeah.
So are all of these recovery residential sober living mandated?
Are you asking whether or not in that environment people abstain from using? Is that the question?
Do we prohibit drug and alcohol use in the recovery residentials?
Yes, we definitely, people are not allowed to be actively using in those facilities.
Okay, because that's, I mean, and I know we need more of these, but it's tough to get them into a neighborhood if the neighbors are out there thinking that this is still a place where people can use drugs or alcohol. So I think it's great. And I did have a quick question. You mentioned something about North County Inland having new beds coming on board. I can't forget. At Tri-City, is that facility open yet?
So
we had 16 psychiatric beds that were supposed to open.
Yeah. They are in the licensing process right now with the State Department of Healthcare Services.
Is there any, I'm stuck on end dates here. Is there any end date soon, or, because I took a tour of it. It was done a year ago, and it still isn't, I guess, in use at this point in time.
Yeah, so there were some challenges with it was a very complex sort of situation with so there's a provider and then Tri-City and then us. It's like a three-way agreement. So there were some challenges in terms of getting the agreement nailed down. And then the provider is coming in and is now going through the licensing. And this is the first kind of puff in our region. So it has been a bit challenging, but we imagine that it's going to be open hopefully by the end of this year.
Okay, I hope so. All right, thank you.
Any other questions? Supervisor.
A quick statement when it comes to state licensing and anything that we need from the state, let us know, because the state, there are representatives at the state that need to help us to back up what they're saying about what the county is doing. So let us know. Thank you.
Thank you.
Any other comments? I just want to say this is really great. You all were here less than 6 months ago, and we had a chance to update the public on the plan and how it's moving forward, and I think this is another really important update. It's a lot of progress in a pretty short period of time, and this is very innovative. I think there's a lot of elements to this. I really appreciate sort of the diversity of approaches, everything from the outpatient treatment, the sober living facilities, the crisis stabilization units. There's just a lot there that you're kind of looking at all the different needs that people present with, and not, when you have a hammer, every problem looks like a nail. And I think this is the example of us trying to really help folks kind of where they're at in the continuum of care. So thank you, and let's just keep focused, eye on the prize. This is great. With that, let's take public comment.
Thank you, Chair Lawson-Remer. We have 17 requests to speak on this item, 6 in person and 11 requesting to speak by phone. Also note that we received 3 e-comments, 1 in support and 2 in opposition. For any individuals that requested to speak on item 25 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please come forward and stand on the arrows until it is your turn to speak at the podium. Again, because there are 10 or more speakers on this item, you will have 1 minute to address the board, and I'll ask you to begin by stating your name for the audio record. I'd like to invite forward the first 3 individuals, Consuelo, Paul Dunlap, and allegedly Audra.
Okay, we're on 25, correct?
Yes.
Okay. 2 minutes?
1 minute.
Ooh. Okay. So this proposal, Consuelo, this proposal talks about optimal care pathways, but there's nothing optimal about it. Government keeps creating new departments, shifting money, hiring friends, and calling it transformation. Meanwhile, people go without real care. The sick stay sick. Families keep struggling. If this is if this was about health, we wouldn't be feeding people processed foods, toxic agriculture, chemicals, and synthetic drugs that destroy the body. Big Pharma is profiting at record levels while communities fall apart. This isn't about healing, it's about dependency. It's a racket. Stop pretending it's care when it's just another scheme to keep people under control. Nothing is getting better. Government is only getting bigger, and the people are literally funding all of these injustices. And even the mention of the 2030, even the UN has a global plan, the 17 Sustainable Development Goals under Agenda 2030.
Thank you. Your time is up. Next speaker, please. I'd like to invite forward the remaining 3 speakers. I'd like to invite forward Mark, Joshua Bohannon, and Rachel Hayes.
Mark, this is one of the most dangerous things I've seen you guys ever put forth. I know how it's going to be used. Of course, there are necessary uses for it when someone's stark raving mad like a 5150. But more than likely, there'll be a lot of teenagers in OB, transient living, partying as much as they can, like most young people. And when you catch them partying one day, they're going to be on psych meds. There's not going to be anyone for a voluntary hold. Their parent won't be there. They'll be underage. They'll be held. They'll be psych evaluated, and they won't be prepared for that. And any little bit of, if everything isn't perfect, oh, you're a little depressed, we can help that. I've seen a lot of people come out of LSD, cocaine, meth, all kinds of drugs when I was young and be okay. I have not, I don't know a lot, but the few people I've seen on psych meds started out mildly bipolar and became totally schizophrenic. It did not help them. It was devastating. This is truly...
Thank you. Next speaker, please.
That's your drugs, man.
It's crazy being in this world but not being of this world and seeing all the demonic things that you guys do. WIC code 558550.50, whatever. Involuntary confinement of children. You love to do that. It's crazy because you guys act like these children have issues. Look what you're doing to kids. Oh, their children are our future. Let's fuck up our future by fucking up the kids. That's all you guys care about. And Monica, you sit there and you're like, oh my gosh, I'm so offended by these words. I'm so offended. Let's apologize to her. All while we traffic children. You medicate children, Kimberly. Are you guys willing to put all your children through all of these detention centers like Polinsky? Just to see if it's okay, right? If it's not, if it's helping children, what would be the problem of putting your children in there to make sure that it goes well? You wouldn't fucking do that.
Thank you. Final call for Paul Dunlap, Joshua Bohannon, and Rachel Hayes. We'll now hear from the individuals that requested to speak by phone. We will begin with our first caller.
Yeah, typical of certain agencies. Look in the mirror. Oh, this is Paula Bold, sorry. There is no attached report, just a more or less subjective description, no hard data to back it up. I heard the presenter say, we need to meet a numerical goal. So I wonder how far they will do to identify people having a rough day as someone who actually has an underlying disorder, or will they just put them on hold, as it were, by drugging them silly? I agree with Consuelo. You are in the business of keeping people sick. Recommendation 4 seems to expand the bridge housing program to include housing for homeless with serious mental issues. I do not think it is safe or advisable.
Thank you. And then the next caller.
Hi, everybody. My name is Daniel Liederman. I was born and raised in San Diego, graduated from school here. I own a home here, got married here. I was also homeless here, addicted to drugs here, and I also ended up getting and maintaining my sobriety here. I've been sober for over a decade now. In the past 8 years, I've worked on the private side of behavioral health, specifically substance abuse and mental health treatment. I'm talking actual boots on the ground, working with hospitals, families, and other professionals to help alcoholics, drug addicts, and people with mental health disorders get into treatment. Most people don't realize the lack of resources available for people struggling that are covered by Medi-Cal. I've worked thousands of cases where somebody doesn't have private health insurance and is denied care from the hospital, and there are no county-funded beds available. They have nowhere to go, and it's absolutely heartbreaking. On top of all this, a true partial hospitalization and intensive outpatient program that truly reintegrates people back into society doesn't really exist.
Thank you. Next caller.
Hi, my name is Madison. I am a public health advocate focusing on substance use prevention and mental health support for youth and families in North County. I urge you to prioritize youth prevention and early intervention as foundational components of this system. We are facing a deeply concerning trend. The latest national survey on drug use and health reports that cannabis use disorder among youth aged 12 to 17 has risen 74% in the past decade, now affecting over 1.2 million kids nationwide. And locally, we're seeing the same signals: increased marijuana use, worsening mental health, and kids in crisis far too early in life. We cannot afford to wait until these youth show up in emergency rooms or enter housing programs. We need to build a front-end system because prevention is infrastructure too, and it's far more cost-effective and humane than crisis response. Let's invest in keeping kids out of the system, not just treating them once they're already.
Thank you. Next caller.
This is Peggy Blocker. Looking at escalating behavioral health and substance use disorder and care needs, it's impossible not to link these in part to escalating marijuana use and to ask why this board continues to push for 35 more pot businesses in unincorporated areas. You frame it as equity, but it's really a system for addiction that harms, not helps, vulnerable communities. Promoting a psychotropic drug puts thousands at risk of adverse behavioral health outcomes. Analysis of 99 studies showed that 70% of THC products have an unfavorable association with psychosis or schizophrenia. This should make us ask, what are you doing by adding 35 new pot businesses, especially to young people? What will it cost in terms of treatment? Please consider the irresponsibility of...
Thank you. Next caller.
Hey, Tara, why did you go ahead and remove your voicemail so that no one could go in and leave it? Huh? Because you didn't want to hear from me? I definitely understand that because... And Joel, you support making sure that people feel like that they're nothing, right? When I call your office and they recognize I'm calling, what happens? They pick up and then immediately hang up, correct? I mean, they do this over and over and over. I mean, I recorded it. I didn't have to worry about California laws because I knew I wasn't going to be having anyone on the other end of those lines. Every single one of you, for years and years and years, you treated me like I was nothing. Nothing. And then when I started getting more vocal, Tara, you went ahead and convinced the county to go, 4 people in the county to go ahead and file the restraining order, which you hide behind. And then you want to say I'm harassing. It's not harassing if you don't return a call, if you don't pick up.
For the record, that speaker was Gambler Hermes. On to the next caller.
What's that guy's name? First name? Justin Castro.
It's true. Based on the stats Paloma read earlier, it sounded like she admitted that 10% of these socialist welfare programs are benefiting fraudsters. Whoever disagrees is basing their lies in anti-American racism, because those who entered our country illegally have no right to the $658 million Medicare that legal immigrants have earned the right to. So that type of anti-immigrant rhetoric from Paloma needs to not influence this board's decision. If there's no fraud, Paloma, then why is AG Bonta initiating lawsuits against the Sweetwater Care Facility, where elders have been neglected and abused despite receiving $300 million from Medicare and Medi-Cal tax dollars? Fraud doesn't just happen with those who receive services. It also happens with those who provide the services. Short-term bridge housing for individuals with serious mental illness and or substance abuse, is that like the EMS call monster, Windsor Point, Carlsbad, that's going to be recreated at the 16 sleeping shacks in Lemon Grove to go along with the naloxone Narcan vending machine blight on Broadway? The 3 privileged supervisors need to quit pretending you understand the hardships of us regular people. You don't. You're not like us. You're phonies.
Thank you. Now hear from the next caller.
Good afternoon, Board of Supervisors. My name is Terry Ann Skelly. Regarding item 25, the title says that we will be receiving an update on substance use disorder optimal care pathways model. However, item 25 is primarily about authorizing applications for round 2 of behavioral health continuing infrastructure program funding and agreements with the California Department of Healthcare Services. More information regarding where the county is now with its substance abuse prevention and treatment services would have been more useful. As you mentioned in the item's equity impact statement, National Survey on Drug Use and Health highlights persistent treatment gaps. In 2020-23, an estimated 19% of the population needed substance use treatment in the past year, where only 25% of that large number is actually receiving treatment. This is especially true for young adults between.
Thank you. Now hear from the final caller.
This is Ann Riddle. Good afternoon, Board of Supervisors. Thank you for the additional beds that we are expecting to come online because of this additional money. Gravely needed. Those of us who've worked in social work and in the nonprofit sector recognize these needs. I would especially like to address the needs of children. I didn't ever see anything about partnerships with Rady Children's Hospital. And Rady Children's Hospital has provided a lot of media regarding their need for more pediatric mental health, and that they're doing all they can to expand the number of beds available in what they consider the mental health crisis. And they're not wrong. The same National Survey on Drug Use and Health that you highlighted mentions about children, that increase among children, we're talking under 12, has increased dramatically.
Thank you. And Chair Lawson-Remer, that concludes public comment on this item.
Okay, thank you very much. Any additional comments, or do I have a motion from my fellow board members? Supervisor Geary.
Just a quick comment. I want to thank Nadia and her team for all the work that you've done. This is something that I heard a lot about during the campaign. The hospitals, their EDs being impacted because of not enough continuum of care. And I think this is a great start. And I know there's a lot more work to be done, and there's a lot more funding for us to receive from the state. So looking forward to the good work that still remains. Thank you.
Thank you. Well, I'm happy to make a motion.
Second.
Okay, we have a motion and a second. Please vote.
Chair Lawson-Remer, that motion passes unanimously with all supervisors being present and voting aye.
Thank you. We'll now turn to item 26, improving youth safety in juvenile detention facilities. This is an item introduced by District 1 and District 4, so I'd like to turn it over to my colleagues. Vice Chair Montgomery-Stepp, do you have some introductory comments?
Yes, I'll start off as soon as folks are ready to listen. Okay. This item was born out of a lot of kind of anecdotal evidence that I heard from advocates, parents, but then it was also backed up by reports that I found that the county was receiving, and then an investigation launched in May by the Department of Justice. And so I have heard, with the combination of all of those things, and hearing about the way our young people are being treated in juvenile detention facilities, including the use of excessive force and the reliance on room confinement. As stated, I've spoken to our constituents, including the parents of detained youth who worry about their children, who feel helpless to do anything about it, and sometimes feel scared to speak up in fear of retaliation of what may happen to their kids. So I want to be clear before we go to public comment about what this proposal does and just line it out. First, I'm proposing that the board establish an ad hoc subcommittee on juvenile justice, appointing myself and Supervisor Aguirre for the purpose of analyzing and proactively addressing concerns and opportunities for improvement in youth detention facilities in juvenile justice overall. The proposal includes the ability for the subcommittee to work with a lot of different stakeholders, bringing folks into the same room. And I know that there are several different councils, coordinating councils. I think the specific purpose of this for a time that we're dealing with, especially because there is an active investigation, it's important for the supervisors, I think, to lead the charge on this subcommittee. That's why it's in this board letter as a recommendation. Secondly, the proposal would direct, approve, and authorize the director of the county's Department of Purchasing and Contracting to renew its current contract with CJJA. That's the Council of Juvenile Justice Administrators that we've been receiving reports from since 2017 that I barely got to look at maybe 6 months ago. We want to continue on in this monitoring and having these reports and have the subcommittee be a part of receiving and analyzing these reports. I think for far too long, the Board of Supervisors has been in the dark about what's going on in the facilities. And CJJA was previously unable to come to the board with their findings, so this would have the board be able to have easy access to those findings along with the probation department. It has not ever been like that before. Third, the proposal directs the chief probation officer in collaboration with CJJA to report back to the board within 60 days with a plan for the phased elimination of all chemical agents, including OC spray, in the San Diego County Youth Detention Facilities within a 2-year period. I'm particularly troubled by what I've read and heard about the over-reliance on OC spray, commonly referred to as pepper spray, in dealing with our youth. OC spray is measured in Scoville units, and 1 unit is equivalent to the heat of a single jalapeno pepper. However, the heat of the law enforcement issued OC spray is over 1,000 times more powerful than that heat from a jalapeno pepper, and significantly more powerful than commercially available mace sprays. This is being used in facilities in situations where I think there is an over-reliance, and in situations where I think it is unnecessary. So we're calling for that ban, and we are giving the probation department 2 years to phase that out. We will probably hear a lot of comment about that today as well. We're open, that's why we have the subcommittee, but I really just don't think that it's necessary at all for any child to be sprayed with chemical agents. That's why the proposal is within this board letter and a part of the recommendations. Finally, the proposal directs the chief probation officer with CJJA to report back to the board within 60 days with a plan that considers best practices, both short and long term, to reduce and de-emphasize the use of force and room confinement. Unfortunately, we have also received reports about the overuse of room confinement. We know that's also known as solitary confinement. Numerous studies have shown that the use of room confinement is harmful to incarcerated youth and actually increases the likelihood of recidivism. So we have a real opportunity to be in line with state law here and to change the approach in our juvenile justice, in juvenile detention facilities. That is what this board letter proposes. That is what it's about. And I just want to emphasize here that we are under investigation, and this is really on the board. And, you know, it's one thing, there are different parts of our public safety system here within the county that we have less control over. The district attorney is an elected official, as is the sheriff. But the probation, the things that happen within our probation department, that's on us. And so I will not sit back. Well, we know that we are being investigated. The DOJ and the Attorney General, Rob Bonta, has a lot on his plate right now. I don't think he'd be investigating us unless there was something to be investigated. And so we are putting this forward because I think that we need to do something. I think this is a reasonable approach. It has a subcommittee for continued monitoring. It has a continued contract with the administrators that have come in and kind of given us a rundown of some of the things that we need to do over the last 7 years or so. Some of those things I think have been done, but obviously not all of them. And then it gives a 2-year time frame to phase out that use of the OC spray. So anyway, I am hopeful for the board's support on this, and I'm looking forward to the discussion and the public comment, and I will go ahead and move the item now. Thank you.
I'm happy to second, and let me turn to my colleague, Joel Anderson, Supervisor Anderson, for his comments.
I've always been a big supporter of moving in this direction. There are a few issues, though, I have concerns over. In LA County in 2018, they moved forward in this direction. They're still using pepper spray today. But when you go through and you read the Inspector General's report on this, a couple of items came up that I want to make sure that in part of our analysis that we're looking at. One is they increased the surveillance. There weren't enough cameras in enough places that allowed probation officers to observe without having to engage. The second thing is, on this, we're saying that we want to get rid of it, and we're talking about children. They changed who we have in our detention to 25-year-olds. We could be talking about a guy who's 6'2", 280 pounds, and 25 years old, or 21 years old, or 24 years old. I want to make sure that we don't come to conclusions on the use without best practices. So I would like to, instead of saying that the goal is to eliminate it, that we move to the best practices and that we look at the scope of the use. So it's not being used on a 9-year-old. It's being used in a situation where perhaps a slighter built deputy is there, an officer is there, and maybe they're 5'2", 110 pounds, and they're up against a 280-pound man. Because at 24, while you may be a juvenile by the courts, you're still a man. You're pretty fully developed. Maybe not mentally, but otherwise. So I'd like to look at that. And then the other part is, I'd like to understand why Probation Officers Association wasn't included as part of the oversight and input. And maybe it is and I missed it, but could somebody speak to that?
Happy to speak to a couple of things that you mentioned. One, if the chair, if that's okay. One, I just want to say that California is one out of only 6 states that still allow the probation officers to carry the OC cans on their person at all times. That's one. 2, you did mention Los Angeles County. Appreciate that. They are, as of Friday, under receivership. So their board has lost all power over their facilities based on some things that they have done and the lack of action, which is another reason why I think that this letter is important.
I didn't say we should follow their lead.
I'm just saying,
I just used it as a
they
reference.
eliminated it and they're
I
still
just used it as
using
the reference of what the Inspector General said about them in terms of surveillance. So I'm not suggesting that we go into receivership. I've been down that road. It's not a good road.
Happy to discuss our current surveillance in the subcommittee. I don't have an issue with that. But another thing that we want to do to try to supplement this phase out over a 2-year period is the MAT training that will allow for officers to have additional de-escalation techniques and tools, understanding that, yes, the state law changed to where we, in order to bring young people closer to home, there's a lower recidivism rate, right? A higher success rate when young people come back around their own environment. And so that was the the reason for the change in California laws as it pertains to the juvenile justice system and the juvenile detention facilities, but this is still a percentage, right, of the entire population. So what I want to keep the language the same when it comes to that, but that is the reason for the 2 years and for the subcommittee, because if there is evidence that we come back that we want to change any of that policy, these recommendations still give us the breadth and room to do that. I do want to say, too, the counties that have completely banned, we do have plenty of California counties that have done that: Sacramento, Santa Clara, San Francisco, Sonoma, Santa Cruz, Marin, Solano. They've all banned the use of OC spray in all of their juvenile facilities, and they've been able to do that. You reminded me that I wanted to add something to the recommendation that has not been included in here as it pertains to the probation officers association. And let me just find it here, because basically it includes the employees that are represented by labor organizations that work in the facilities and in the department into the subcommittee feedback and as a stakeholder. And so we certainly want to make sure that we do that, but I can tell you that it goes back to the investigation. And these things have been recommended for years on top of years on top of years. I wanted to move it forward and have the conversation. But, I also want to work with the officers on some of the other things that they are asking for because of the nature of their jobs and because of the stress related to their jobs. I'm certainly open to having all of those conversations, but I think that this needs to move forward with that included in having the labor organizations at the table as we move through and make these decisions.
I apologize. So the probation officers will be part of it?
Yes, labor organizations. There are some employees that are part of other labor organizations as well, but yes, probation officers. And I'll get the language so I can read it to you specifically. I just can't find it.
Okay, because the way it reads now, they don't believe they're part of it, and I don't believe they're part of it. So I'm looking for an amendment that would actually include them.
Yeah, let me find it for you.
And when I looked at the analysis of those counties, Marin County is not close to who we are. When you look at first of all, the number of folks, it's 100. It's not close to the numbers we have. They also come from very wealthy communities, unlike many of the folks that are in our custody. And
Supervisor,
I'm not saying
I don't want to go back and forth the comparison of all the counties, but I just named 7, and they're all very different. And again, we have some time. It's not like this board letter would say, tomorrow you have to end it all, right? And then the clerk is going to put up the language so that you can see it. I understand what you're saying. I still think that we can do this.
The concern I have is not just for the probation officers, it's for other folks. So if you have a young man who's 24 years old that's 260 pounds and they're in a fisticuff, I think we can get there. I don't want to rule out possibilities by saying even if we know it's the best policy, we're going to move forward with this despite it going against the best policy. And I'm thinking if we focus on narrowing the use of it to best policy, and if best policy is 0 use, I'm good with that too.
I understand.
But starting off with 0 over a 2-year period, still 0, and yet we're not even taking in. And I think that when we look at the level of difference of who we had 10 years ago and who we have today, we didn't have a bunch of 25-year-olds in there. we didn't have the same level. These people would have been, in some instances, in our prison system. So I just want to make sure that we're making the right choice so that as we move forward, we have that flexibility. The other part is, will the committee be coming back? Too often, we come up with these lofty goals, which I agree with, and then there's no funding for it. So will we be looking in the ad hoc committee what the cost of some training is going to be? Because I believe that in most of these instances, better training is the direction we need to go, and better is part of the practices. What are your thoughts on that?
We have 60 day turnaround one for the phase out plan, so that we can discuss a lot of what your concerns are and everything, to see if they're addressed in that plan, and if not, we can discuss it then. Report backs are super important to me, as I mentioned on the last item, and I haven't been on many subcommittees here, but everyone that I have been on, we've reported back, because at the end of the day, it's the majority of this board, right? Any ad hoc committee is not going to make overarching decisions for this board, but it is a mechanism to get the ball rolling and kind of be a part of the shaping of the policy. So the 60 days, yes, there will be another opportunity to express concerns there. Every one of these stakeholders we will reach out to prior to that point. And I'm sure the chief of probation will as well. So yeah, we have a couple of timeline and deadlines within the board letter that will facilitate the plans coming back to the board.
Is under this language, if the subcommittee came back and said there are circumstances in which we have to keep pepper spray, does this board, does it allow for that? Or does it narrowly tell them where or does it say we have to find the best practices to get to zero, not the best practices overall?
Why are adults in Judy?
My goal is to
Hold
get to
on,
zero.
hold on. That's your first warning.
Okay, but why?
Sir, we're having a conversation among two people who are really trying to hash out an important policy issue. Thank you. There will be an opportunity for public comment later. Go ahead, Supervisor Montgomery-Stepp.
My goal is to get to zero. There are extenuating circumstances that require different policy or choices before I'm willing to bring choices before this board. My goal is to get to zero.
So so the ad hoc committee won't be looking at anything but zero, as opposed to?
No, I think that it's fair to bring options before this board. My goal is to get to zero.
And I'm good with zero.
Yeah.
I mean, but what I'm worried about is grown men.
I understand.
And this is not the population we're talking about 13-year-olds.
I also just really, especially based on the day we've had today, we have to be aware that, and I know what you're saying, I understand it, but we also have to be aware of a narrative that can be controlling, that allows us to concentrate on the few that you're talking about and ignore the 150 other young people that are also that are suffering from having chemical agents sprayed and having a lack of de-escalation techniques and overuse of room confinement. So I just want to be careful that I'm saying that I hear you, but there is an entire population, and also some of the stereotypical things that we also hear about this population. There's still a process that they have to go through in order to even to be eligible for detention in the youth facilities, right? So there's a lot there that I want to make sure that we're not even overusing that. That is also a separated population to We want to look at the entire picture, and that's my commitment for the subcommittee.
I really want to get to yes.
Could I propose we hear from public commenters?
I'm just going to finish this
Okay.
comment. I really want to get to yes, and I'm just not there because I'm afraid we're putting our thumb on the scale. And I think that if the ad hoc committee had the flexibility to bring back best practices, I could easily get there. And, you know, in my mind, without knowing all the facts that they're going to uncover, for somebody of that age group, I'm not sure that putting our finger on the scale saying our goal is 0 and 0 is the answer, I'm not interested in the lawsuits that are going to come because people are beating the snot out of each other and we have no way to even address the issue. And I just wanted to, and look, I'm not speaking to the vast majority who are teenagers who, that we shouldn't be using pepper spray on, that we should have. But when you're talking about men, full-sized and motivated, I just want to make sure that we're not creating additional lawsuits and that we look at the full picture. We're not already assuming the end goal before we even get started. And, you know, if we could just get to, our goal is to get to 0, but we're willing to accept best practices, even if that answer is not 0, and that's not what I'm hearing, I can't get there. And I really want to get there because I really think that the work is good, but if we're not looking at best practices with an open mind, we're not going to find best practices. We're going to find lawsuits potentially because it's not going to be definable because we're already telling what the outcome's going to be.
Looking forward to hearing public comment. We can circle back.
Okay. First of all, I just want to appreciate my colleagues. I think this is a really important conversation, and I appreciate being able to have a real dialogue on the dais where we're really focused on trying to get to a policy that really makes sense and grappling with some hard issues. So I appreciate that from both of you. We will now turn to public comment, and then we will have an opportunity to continue the conversation.
Thank you, Chair Lawson-Remer. We have 42 requests to speak on this item, 24 in person and 18 requesting to speak by phone. Also note that we received 136 e-comments, 15 of those in support, 121 in opposition. For any individuals that requested to speak on item 26 by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please come forward and stand on the arrows until it is your turn to speak at the podium. Because there are 10 or more speakers on this item, you have 1 minute to address the board, and I'll ask you to please begin by stating your name for the audio record. I will be calling you in groups of 3, so I'll ask you to please listen for your name. I'd like to invite forward the first 3 individuals, Consuelo, Jennifer Fox, and Veronica Limon.
Okay, so improving youth and safety in juvenile detention. Okay, how funding things to prevent them from being, how about funding things to prevent them from being in juvie in the first place? How come we don't do that? But that will never happen. Why? I'll say it again. This is the result of the system. Government never will, never has, and never has tried to get to the root of the problem because they are at the root of the problem. They are at the root of all our problems. They are the source of all our problems. Might I add, profitable problems as well. It's an insane asylum, really. And the ones who are standing up to it are being censored and silenced. And anyone who wants to try and fix this foul system, a system that should never be resuscitated after it dies, needs to wake the fuck up.
Next speaker, please. If I've called your name, please come forward again and stand on the arrows. Thank you.
Good Good afternoon. My name is Jennifer Fox, President of the San Diego County Probation Officers Association. Based on the realities inside our facilities and to ensure our officers' needs are being considered, we respectfully request that the focus be on reducing OC use, not eliminating it. It is a last resort tool used only after every effort at de-escalation fails. Without this option, the only remaining response is to go hands-on, and this is riskier for both youth and staff. Thank you for the opportunity for frontline staff to have a real voice in this process. We have both a vested interest in reducing violence and understand the consequences when policies don't match reality. Lasting change requires more than just eliminating a tool. It requires adequate staffing, ongoing training, meaningful program for our youth, and clear measurements of success. We are not resistant to change. We are here to make sure that that change works. Thank you.
Thank you. I'll call 3 additional speakers. Derek Nakaza, Francisco Moreno, and Stephen Wilson. If I've called your name, please come forward and stand on the arrows. Thank you.
Good afternoon, Board of Supervisors. I'm Veronica Limon, Vice President of the San Diego County Probation Association and a Senior Probation Officer. The Probation Department is unique in that female officers outnumber male officers. In contrast, the majority of our youth population in the facility are males ranging from ages 14 to 25. If we are going by pure biological makeup, there is no way that a female like myself can physically overpower a male that only knows how to express themselves with physical aggression. I disagree with the recommendation that stated that there will be no fiscal impact to this change. The county has already reduced our budget and now wants to take a valuable tool away. We can agree that there is room for improvement and we welcome additional training. However, additional training requires an increase in our budget, not a reduction. We cannot continue to do more work with less resources and expect great results. For these reasons and many others, I respectfully oppose this item. Thank you for the amendment and the seat at the table.
Thank you. As the next speaker is coming forward, I'll invite 3 additional speakers.
Hello, my name is Derek.
Before you begin, sir, let me call 3 additional speakers. Thank you. Allegedly Audra, Libby Yuramovic, and Dylan Quigley. If I've called your name, please come forward.
Hello, my name is Derek Nakeza. I'm a director with the Probation Officer Association. In October of 2019, I was involved in a violent incident where a youth in custody attacked an officer, and I intervened without the use of OC. Since that day, I've gone countless medical appointments, therapy, medications, and even surgery. And despite all of this, I continue to suffer from permanent nerve damage. I should also note that youth was 6'3" and over 300 pounds. Incidents like this cost the county millions of dollars each year in worker compensation claims, medical expenses, and an increase in overtime. Let me be clear, OC is not used as a punishment, it's a safety tool. California legislators have rejected a statewide ban on OC 3 separate times. Our system is grounded in rehabilitation, not retribution. And I urge all of you to come take a tour at both our facilities and talk to the line staff and what we do every day, because we do change lives into the probation department with OC. Thank you for your time.
Thank you. Next speaker, please.
My name is Libby Yuramovic. I am the forensic auditor of government agency that brought the state and federal complaints in. Never mentioned OC. No, not on the complaint. So we can take that rabbit hole out. The complaint is about the torture and abuse of minor children. Boiling showers, freezing showers. That's a violation of war crimes. That's a violation of the Geneva Convention. You have stakeholders. How come I'm not invited? I'm the one that can tell you everything that is on the complaint, everything going on inside. Why aren't the children that are being tortured and abused invited to the table? The only stakeholders are the people making money off this trafficking of children. Doesn't that tell you something? Would you like to invite me to the table? Manuela Guerri, Monica Stipe? I'm the one that has all the information. Would you like to invite me to your ad hoc committee? There we go.
Next speaker, please.
Good
Good afternoon. My name is Dylan Quigley. I'm a staff attorney for the Youth Law Center. We're a national organization that advocates on behalf of system-involved youth. However, while we have staff across the country, I live here in San Diego in Golden Hill in District 1. And I'm happy to get to speak with you today. We're strongly in favor of the elimination of OC spray, and we very much appreciate Supervisor Stepp bringing this to the board. The thing that I want to emphasize is that time is of the essence. We have known about the problem of OC spray in San Diego jails since at least 2012. This was substantiated by a Disability Rights California investigation that happened in 2016 and a complaint that YLC filed in 2014. It is absolutely necessary to have a definite timeline for the elimination of OC spray, where it will simply never happen, just like in Los Angeles. Thank you.
Thank you. As the next speaker is coming forward, I'll invite 3 additional speakers: Michael Golden, Mark, and Kim Jones.
The board is in the dark. My ass, Monica. My ass. Yeah. It's interesting because it's like you guys, a subcommittee of perpetrators, just like when you guys are like, let's go out and pretend to help the people that are coming in and speaking about their children being ripped apart, and just kind of put it off and say, like, we're going to help you, we're going to go talk to the director, and then say, you know what, there's nothing we can do, just listen to the agency, right? And it's funny, this is all because of an investigation, Monica, and you fucking know it, because you guys are trying to save your ass. You don't really want to go into, yeah, no, I'm going to continue because you don't do shit. That's what's so fucked up, Monica. It is. It really is.
Asking you not to curse. That's
I'm going to cuss all I want. And you know what? God has me here for a reason. Imperfect people he uses, right? But he sees you for your darkness. And I don't mean that by the color of your skin, so don't get it fucking confused. Anywho, so this, yeah, it's all about an investigation. And it's interesting because you don't care about children that are being suffocated or sexually abused, but you care about pepper spray, right? Thanks for wasting my time. Get behind me, Satan.
Next speaker, please.
Good afternoon. My name is Michael Golden. I'm a 30-year resident of Lemon Grove, and I taught environmental biology for 30 years at a local community college. And in 2009, we had a family crisis. My son was arrested for something very serious, 16 years old. It didn't harm anybody, was still serious. Went into the probation system, and I will strongly disagree. There is no rehabilitation in that system whatsoever. It is confinement, it is control, it is punishment. That's what it's all about. And so I would like to see us look outside the box. These are children. These are our children, okay? And they are in crisis. We call that committing crimes. Yes, they have issues, but they need intervention, and there's no mental health. When my son was in and out, there was no mental health. He also had drug addiction problems. There was no drug addiction help at all. And they gave him 30-day job. Anyway.
Thank you. Time is up. Thank you. Next speaker, please. Thank you. Thank you.
Sir, please finish your comments. Thank you.
Good afternoon. I'm Kim Jones from the Kinship Fund, a San Diego-based foundation, and we fund nonprofits that walk alongside youth through mentorship, helping those with the least access to opportunity to discover their full potential. And I speak today in support of forming an ad hoc committee. If we share a common goal of both keeping our community safe and ensuring our youth do not end up in the pipeline to a lifetime of prison and justice involvement, then we need to start by critically examining our current juvenile justice practices. Most of the dissension around this item is focused on officer safety. As a mother of a law enforcement officer, that matters to me too. I know that he puts himself in harm's way every day. Instead of preventing a deeper evaluation of the state of juvenile justice, I call on you to believe that there is a way forward that addresses both concerns. We know that incarceration harms young people's physical and mental health, impedes their educational and career success, and unfortunately exposes them to abuse. There are many ways that room confinement harms youth, including evidence that isolation impacts cognitive development. And research underscores that both the use—
Thank you. Thank you. Next speaker, please. I'd like to invite 3 additional speakers: Tristan Beery, Ron Sanchez, and Alejandro Martinez.
Mark, first of all, Rob Bonta announcing an opening of a civil rights investigation is an oxymoron. Secondly, it's so blatantly obvious that before anything else, there shouldn't be anyone one day over 18 years old in juvie, in any juvenile detention center. If you can't just figure that out and say that right now and change that, you're useless and ridiculously stupid. As far as, I appreciate that you're trying not to pepper spray children. I know some of them are quite unruly. I'm sure that you can hire a few really large people that can easily take care of a relatively large juvenile. If you keep them separated from violent adults, duh. And the fact that you actually, Joel, I mean, you guys are trying to help, that you were trying to rationalize, like, pepper spraying.
Thank you. Thank you. Next speaker, please.
By the way, a parent would go to jail.
Mark, your time is up. Thank you. Next speaker, please.
Hi, County Board of Supervisors. My name is Alejandro Martinez. I'm a youth community justice organizer with Mid-City CAN. I want to start off by honoring the voices of incarcerated and formerly incarcerated youth who are not here today to share their testimonies. I remind us that their experiences matter and that their voices need to be the vehicle for change as we push towards healthier and safer communities for all. I'm going to be very respectful because I know of good people who work in probation who believe in transformative justice and the true rehabilitation of our young people, who believe in a world free of any forms of violence against our children, of forms of violence within the lives of our communities, who dream of a world free of prisons, of gangs, drugs, and further violence, a world of harmony, of understanding, of compassion, love, and care. When you eliminate the use of OC spray and room confinement as a form of punishment, you invite the opportunity for trust and relationship building. It requires you to learn about de-escalation training. It requires you to look at your role in a different lens, and one where you're not law enforcement, you're a mentor, an adult tasked to caretake someone in a very, very vulnerable situation in their life. What a gift you have. I fully support District 4 Supervisor Monica Montgomery's STEPS initiative. Thank you.
Thank you. As the next speaker is coming forward, I'll invite 3 additional speakers: Laura Beza, Michael Villa, and Rachel Hayes.
Good afternoon, Chair. Good afternoon, Board of Supervisors. I'm Ron Sanchez with Mid-City CAN. I just want to say, like, I've had the honor of working with youth, and when you provide them with resources, opportunity, encouragement, it's really so amazing what they can do, all youth. I've watched our youth council members advocate for their neighborhood park, and they got $4.25 million from the City of San Diego budget to renovate this park, you know? And I feel the same way with incarcerated youth. They are like broken. They are in a healing stage, and they need resources, opportunity, encouragement, and this is why I support Supervisor Stepp. Like, pepper spray is such a cruel, cruel punishment, and many of these youth incarcerated already come from an environment of violence, and that punishment is just so cruel. So please find alternatives for them.
Thank you. The next speaker is coming forward. I'll invite 3 additional speakers: Queen Mother Harmon, Chloe Hodge, and Alicia Robertson.
Hello, Board of Supervisors. My name is Laura Baeza, and I'm a District 1 resident and organizing and policy manager with the Alliance for Boys and Men of Color. We're a statewide organization working with hundreds of community and advocacy organizations who work together to advance race and gender justice by transforming policies that are failing boys and men of color and their families, and we strive to build communities full of opportunity. This is why today I'm here in strong support of this item, which will ensure we are improving youth safety in juvenile detention facilities. Youth deserve a bright future and a chance to grow from their mistakes, and implementing an ad hoc subcommittee will ensure youth safety and strengthen our community. Thank you.
Thank you. Next speaker, please.
Hello, Board of Supervisors. My name is Michael Villa. I'm a member of the Supervising Probation Officers Association. I've been employed with the Probation Department for 18 years, and I'm currently a supervisor at East Mesa. Thank you, Joel Anderson, for acknowledging that prior to the closing of DJJ, East Mesa housed predominantly children under the age of 18. Beginning in 2023, our population was 32% adults, 68% children. Over the last 2.5 years, after DJJ closed, we currently have 61% adults, 39% children. So the majority of the youth housed in East Mesa are between the ages of 18 and 25 years. Aside from OC, no other force options are carried at East Mesa. All OC canisters are weighed before and end of every shift, so all OC is accounted for. There are occasions when violence has erupted within our facility without warning. Large-scale incidents have occurred at East Mesa involving up to 20 youths, all fighting simultaneously. Officers are outnumbered, and OC is essential. In the situations I was dealt with, it would not have been a happy ending if we would not have been able to take control.
Thank you.
Thank you.
Speaker, please.
Good afternoon. I am addressing the real problem. I am I'm so upset of what I'm hearing today. I'm 94 years old, and I come here to solve a problem. Most of the people that have come to this podium are not at juvenile hall every week and every day. Neither do they have children there. We do know what's going on out there, and we come to address you. There's no counseling. There's nothing for our youth out there. The staff has been low. It starts with you. It costs money to train our youth. And certainly, for one thing, most of these children come from disarranged families.
Thank you. Thank you. Thank you. Can you?
No, sorry, ma'am. We have more than 10 speakers. And so when we have more than 10 speakers, there's 1 minute for comment. So thank you very much. You can go ahead. Thank you.
Next speaker, please. Go ahead and call the remaining speakers. Crystal Irving and a speaker identified as Arelis. If I've called your name, please come forward. Go ahead.
Hi, my name is Chloe Hodge, and I'm representing East Mesa Juvenile Detention Facility Parent Council, and I'm also a mother of an incarcerated youth. I don't think pepper spray is the answer. I do believe we do have a lack of mental health clinicians at East Mesa. And I know that a lot of these children and these youth come from adverse childhood trauma, and a lot of these issues need to be addressed. There is over 100 kids there when last I heard there's one mental health clinician. I believe that if a lot of these kids had access to therapy, access to services, more than just some of these kids have been given crossword puzzles, word searches in lieu of actual therapy because there is a shortage there. I do believe that they will benefit the community and reduce the rates of recidivism even more if they are given therapy and rehabilitation such as probation promised that they would have. Thank you.
Thank you. Also like to invite forward Jared Wilson.
Hello, my name is Alicia Robertson. My grandson is at the East Mesa Juvenile Detention Facility. We organized a parent council so that we could work with the facility about some of the things that are going wrong. This is a serious issue. There has been a few young men there that have been pepper sprayed and have asthma. It's not good. If there's other alternatives and other ways to do it, we are in total agreement. But there needs to be a media for everything to work together, and that the children can progress according to the mission statement of the juvenile division, that they come out and be an asset to society. So we desire to work with and to help, but our children need to be protected as well. Thank you.
Thank you. Next speaker, please.
Hello, my name is Crystal Irving, and I'm proud to serve as president of SEIU Local 221. As this board knows, we represent support staff in the probation department, and there are very mixed feelings and reactions around this item amongst our members. We recognize how we got here and why this proposal is an appropriate response. We all share the goal of keeping youth in our custody safe, and we also want to emphasize the importance of a deliberate rollout that allows for training, procedures, and appropriate staffing to keep our staff safe as well. I heard Vice Chair Monica Montgomery Stepp speak to including labor organizations as stakeholders in Recommendation 1A in her response to Supervisor Anderson. So thank you so much for listening to our concerns and doing this in a way that provides opportunity for our employees to engage in this important conversation. Our members can speak to the challenges they've experienced as well as provide insight to solutions. And on a personal note, thank you, Vice Chair Monica Montgomery Stepp, for being unwavering and continuing to advocate and represent communities that have been intentionally and historically underrepresented.
Thank you. I'd also like to invite forward Joe White.
Good afternoon. My name is Arelis, and I am a mother of a detainee at East Mesa. I think we're all focusing on so much on pepper spray and trying to figure out what is acceptable or not. When you have, I know it's a hard job, but when you have officers popping M&Ms while they are aware that an incident is going to happen and they just let it happen and then go over there and pepper spray, that's the issue. We're not trying to help these youth get back in the community safely when we're actually not doing what we're supposed to. So it's hard, it's heartbreaking to see everything that happens inside and I'm saying happens because the mission is not there. They're not following through the mission because there's one clinician currently for 130 youth. All of these kids have past trauma. How do they cope? So thank you so much for your time.
Next speaker, please.
Good afternoon. I'm Lieutenant Jared Wilson. I'm here today as the president of the San Diego Police Officers Association. Over the past several years, San Diego Police Department has investigated and solved numerous horrific murders where the suspects were juveniles and booked into our juvenile hall. Since the criminal justice reforms over 10 years ago took hold in California, juvenile halls have become custody facilities for only the worst of the worst. We cannot place nonviolent suspects into juvenile hall. The probation officers who work in juvenile hall have a dangerous job that is critical to the criminal justice system. Their safety and the safety of those in their custody should be the highest priority of the county when making decisions on how this facility is ran. If the county is to take the dramatic action of removing the sole defense tool from its public safety workers, I would say to my brothers and sisters in the probation department, come work for an agency that values you, that will equip you, and that will train you to defend yourself in a fight, whether you're small, large, or a man or a woman. We have over 200 vacancies on the police department. Come work for us and let the county deal with the mess that they caused.
Thank you. Next speaker, please.
I'm sorry, I have to say something. This lady gets more time.
Sir, sit down. This is your first warning. This is your first warning.
I'm a teacher here.
Please sit down.
You serve us. You're not a school teacher either. I have 10 years of college.
Okay, if you keep talking, you're going to be removed from this meeting. Thank you. Okay, sit down. We have another speaker. It is his turn.
You need to respect her.
Okay, that's it. I already gave you one warning. That's your second. Please leave the meeting.
You know I'm right. You violated the law. She's supposed to have, she got 88 exceptions.
Please leave the meeting. Please leave the meeting. Please leave the meeting. Okay, this is your second warning. Please leaving meeting.
Everything to be exposed by God in this city of San Diego. Wait till you see the crimes for us.
Ma'am, if you would like to have a conversation about whether you needed additional time, please go speak with the clerk and we will work it out. Okay? Our attorney will go speak with you as well. Thank you. Okay, please, sir, next comment.
Okay. Good afternoon, Board of Supervisors. My name is Joe White. I'm currently a supervisor, and I also am the president of Supervising Probation Officers Association. I'm here to express opposition to the removal of OC from juvenile institutions. Since the closure of DJJ, or Juvenile Justice Department of Juvenile Justice, some of the youth in our custody are young adults ranging up to the age of 25 and are physically larger than many of our staff. Our concern is that the removal of OC will create an environment where staff will be required to have more hands-on interactions during physical altercations with youth on youth and youth on staff. OC is not a punishment, it's an option as a deterrent or intervention. Officers currently carry OC right now as an alternative. Per our policy, staff are aware they should utilize de-escalation techniques prior to the use of OC. However, the most common use of OC is to stop youth on youth from assaulting each other or assaulting staff. The SBA would like to know what tools the board is going to provide officers.
Thank you. Thank you. I'd like to do a final call for the speakers I previously identified: Francisco Moreno, Tristan Beery, Stephen Wilson, and Rachel Hayes. We'll now hear from the individuals that requested to speak by phone. We will begin with our first caller.
Am I being heard?
Yes, please go ahead.
Hello? Okay. Yes, hello. My name is Ilka Weston. I am the co-founder with Yusuf Miller of TAP that is addressing our needs for our youth as well as our adults under probation, parole, detention, and law enforcement practices. Excuse me? Can you hear me? Somebody just interrupted me. Can you start me over?
Please go ahead.
Okay. So this is one thing that we need to remember. Back in the 70s, when parents were putting jalapeno on people's thumbs because they were sucking thumbs, that was deemed as emotional and child abuse. And that does not allow other people to use that in our detention centers. During the Scared Straight study, 61% of the people in the controlled group for Scared Straight ended up in prison. 87% ended up in prison that were going into Scared Straight. 90% of them are males. 70.9% are our Black African-American brothers and sisters.
Thank you. We'll now hear from the next caller.
Paul Bold. There is some question which incidents mentioned by the Attorney General were the triggers for this action. Perhaps they weren't specified because they are in so many places. So little surveillance, so much evidence. So any ad hoc investigation or corrective action needs to focus on improving public safety at all county facilities where juveniles are held, such as the Polinsky Center, where so many abuses have been recorded. Then there's the school system. I'm sure there are abuses at all the behavioral care centers and immigration centers you set up, like adults confined in juvenile facilities. Good move to make an independent ad hoc inquiry, but the board letter does not say who's already taking what measures or making what inquiries.
Thank you. Hear from the next caller.
Did I hear Joel right? We said, hey, look, 25-year-old guys are kids, and they should be treated the same way? Huh. Yeah. And then the woman that brought all of this attention, she's not part of this committee. And the only people that are part of this committee are labor unions and, NGOs, people that the government pays. Those are the stockholders, right? And those are the people that you listen to, not the public. Is that correct? Is that why that you basically treat me like I don't exist? I mean, I would like to know some kind of answer, any kind of answer, any kind of response. I mean, I went to extreme measures to point out the fact that I exist today. Extreme measures to do that. Did I want to do that? Oh, hell no. But I'm left.
For the record, the speaker is Gambler Hermes. We'll hear from the next caller.
It's truth. Why would Bonehead Bonds investigate the youth transition campus and the East Mesa detention, but not the multiple decades-long allegations of abuse and neglect of children at Polinsky? Very suspicious. How did the $1 million consultants magically miss those countless stories? I support detention facility reforms that make sense. However, I absolutely do not support MAPS training that seems to sympathize with a disturbed individual wreaking chaos. That's no different than offering an addict a needle. How would actively listening to a violent teenager fighting in juvie de-escalate anything more than it would enable and encourage the misbehavior? How is that more effective than the Crisis Prevention Institute method, which actually addresses misbehaviors as well as considers physical safety measures for the responder? Scientific reality says female officers need equalizers. What is the alternative to pepper spray and temporary room confinement? A political union ad hoc on children would be better served by those who've actually proven they can protect children, which this board has not done at Polinsky or any program or even any agenda item that has passed today. Hypocrisy. You guys can't protect anybody.
Thank you. Hear from the next caller.
Hello, my name is Yusef Miller. I'm with TAP, Transparency and Accountability for Probation and Parole, and I support this measure. It is an ad hoc committee for investigation to find out more information so that the board can make a more informed decision. Why would we stop or not advance an ad hoc committee to find out more information? It's not understandable to me at all. So yes, let's find out what's going on with our youth, what alternatives that we can have that would include de-escalation and others. And like the supervisor said, with a goal to zero, but that's not the thing that she's forcing on everyone else. So let's investigate. Let's ad hoc committee it, get the information from boards of supervisors so they can make an informed decision on the safety of our youth. Thank you.
Thank you. Now hear from the next caller.
Hello, good afternoon. My name is Stephanie Jacobs, and I joined this meeting regarding the improvement of youth safety in juvenile detention facilities. My son, on his very first offense, was held in San Diego Juvenile Hall, where he was sprayed with OC spray. He mentioned it was the worst pain he's ever experienced in his life. I think it's important to also mention that he witnessed some of these officers encouraging the fights. My son is 16, and his size and weight are below the average man. No child, especially one in custody for the first time, should ever be treated this way. These kids who need support, rehabilitation, and guidance, not punishment that leaves them traumatized and fearful. I do urge this board to take meaningful steps toward reform by creating safer environments, invest in mental health resources, and ensure that juvenile hall is truly a place of rehabilitation, not harm. Our kids and our community deserve better. Thank you for your time.
Thank you. Hear from the next caller. Next caller is Rashida Hamid. Your device might be muted.
Thank you so much. My name is Rashida Hamid, and I am the founder of the Circle by Epiphany, which is a community empowerment center located on Euclid and Logan, which is a hub for a lot of the juveniles that are in custody right now. We actually, all of our services are based in restorative practices, which is, in fact, evidence-based and best practices. Why not? I'm in full support of item number 26. I would much rather you invest in prevention methods to avoid our youth even being in custody, but using OC spray on juveniles is inhumane. We wouldn't even use that on a dog, so why would we use that on our juveniles and expect them to come out with different mindsets or behaviors? Why not let's get to the root condition that caused them to offend in the first place? So I'm in full support of item number 26. Old methods produce the same results, which led to the current extensive active investigation that's happening right now.
Thank you. Hear from the next caller.
Hello, my name is Claire Snyder, and I'm with Youth Will. I strongly support Supervisor Monica Montgomery Stepp's recommendations. Youth deserve to be treated with dignity and care, regardless of where they're at. I personally think it's kind of deranged that we're incarcerating youth in the first place, let alone using OC spray on them and causing not only physical harm, but psychological harm. They internalize that harm, and that causes more trauma because they're simply not being treated like humans. So I think we should continue humanizing young people, regardless of where they're at. Thank you.
Thank you. We'll hear from the final caller.
Hi, my name is Doreen Govari. I'm born and raised in San Diego, and I'm a senior program associate at the Vera Institute of Justice, a national technical assistance provider, partnering with the county to end girls' incarceration. The majority of the young people incarcerated have experienced at least one traumatic event in their lifetime, and I'd like to just uplift the girls and gender-expansive youth currently incarcerated who will be impacted by this policy as well. Chemical agents like pepper spray can cause lasting physical and psychological harm and can lead to detrimental health effects like blistering, inability to breathe, deterioration of nerve tissue, permanent eye damage. And we've heard from young people directly that pepper spray lingers on their skin and reactivates in the showers even months later. The county should adopt this approach and encourage the use of trauma-informed, developmentally appropriate approaches to behavior management aligned with national best practice. We encourage the board to vote yes. Thank you.
Thank you. And Chair Lawson-Remer, that concludes public comment on this item.
Thank you so much. First, I just want to thank all of our speakers and people who came down to comment. I thought there was a lot of really important viewpoints shared today. And I also want to thank my colleague, Vice Chair Montgomery Stepp, for bringing this forward. I think this is an issue that's long overdue in terms of the board really taking more proactive direction in tackling the challenges we face in our juvenile detention facilities. So I have a couple things to say. I think first is there was actually, I think, a lot of consensus, even though there's clearly like a pretty significant disagreement around the specific use of pepper spray, or OC spray, I should say. There's a lot that I think people agreed on that I want to uplift that I think is given voice in this board item and that I strongly support. First of all is the focus on improving training for our probation officers, improving best practices, looking at best practices statewide and nationally, and seeing how we can bring them to bear here in San Diego County, doing a better job of supporting all of our employees who work in our detention facilities to be trained and to have the skills in de-escalation and the skills in conflict avoidance and the skills in how to look for alternatives rather than confinement and OC spray in managing our juvenile population. I think there was a lot of voices around the importance of training. And I want to front and center acknowledge that the plan that comes back most likely is going to require resources. And I hear that loud and clear, especially from our probation officers who have said time and again that they've been under-resourced, underinvested in. And I see you, I hear you, I agree with you. I think you need more investment, more support, more training, more resources. I think that came through loud and clear today. I think that's come through in other reports that we've had come to this board over the last couple years. And I want to say I'm very hopeful that a good number of the recommendations that come out of this subcommittee and that come out of this process do focus on the additional investments in training and support and resources that probation needs in order to support our young people, to obviously to make sure people are safe, but also to invest in the rehabilitation that we know that they need. So that, I think, is something that, despite the pretty significant disagreement on this one particular issue, I think is a common thread that's both reflected in the board item and I think reflected in the comments. And I want to just voice my strong support for those additional investments. And we need to do a lot more and a lot better. I also want to uplift I think what I heard a lot of consensus around recommendation 4, which is really, again, about training, about alternative forms of supervision and behavior management, and the de-emphasization of the use of force and room confinement. So I think that was another piece that I heard a lot of consensus around. So I think there's a lot here that I think seems to be there a lot of agreement around. I think the only piece, the core piece that I see disagreement around is the issue around the plan to phase elimination of the use of OC spray within 2 years. And I actually think the conversation that Supervisor Anderson and Vice Chair Montgomery Stepp were having before the comments narrows in on the core of the disagreement. I think even in all the comments, I also heard a hope for reducing the use of OC spray, phasing it out to the extent feasible. Where I see sort of the disagreement or the wedge is it phase it out completely or phase it out to the extent feasible? And I think that that's really the small piece of disagreement that I think surfaced here in this conversation. So I will share my thoughts on this. I'm happy to support this board letter today. I think overall it absolutely moves us in the right direction. But I am want to just put on the record that it will be important to me that if in this process of developing a plan and looking at best practices, if through those conversations with our labor partners and our labor groups, that it is deemed, infeasible, I would hope that we would, as a board, have an opportunity to look at that as well. I would love for us to get to zero. I do want to just voice, I'm interested in a process that that brings back the best wisdom of everybody who knows what they're doing, including the Council of Juvenile Justice Administrators, as well as our employee groups. I think that there will be a lot of collective wisdom. I have a great deal of confidence in my colleagues, Supervisor Aguirre and Vice Chair Montgomery Stepp, to collect that wisdom, to take that into account, and to work with folks to make a plan. So I am supporting this today. I do hear the concerns about a complete elimination of OC spray, and I am personally want to put on the record my hope and my intent that if through that process of consultation, that my two colleagues do come to the conclusion that this is unsafe and infeasible, I actually have great confidence that they will come back to us with that conclusion. So I just want to voice that for the record, and that's my intention in supporting this today. And again, I really think this was an incredibly important conversation. I don't think it happens enough where we think in a real way about what is needed to make probation work for our community, it doesn't get the focus and attention that I think it deserves. I am so grateful for the work that all of our probation officers and all of our county employees do who work in probation, and very much excited for a process to kind of move us in a better direction to invest in young people, invest in rehabilitation, avoid lawsuits in the future, and respect civil rights for the folks that are under our supervision. So those are my thoughts and my comments. Again, thank you very much to my colleague, and happy to give you the floor.
Thank you, Chair. I don't think that she is ready to speak anymore, but I do want to give an opportunity for Queen Mother Harmon you're okay. Okay. I just, again, we have motion and a second on the floor, moving forward with that one amendment. It is the purpose of a subcommittee, is the purpose of a 2-year period, to continue to hear the concerns that we've heard today. And we will move forward doing that, provided that this passes today. That is my commitment publicly, to hear all sides of it, again, which is why didn't ask for anything to happen immediately, but inclusion of all voices. I do just have to say, though, again, speaking for those who literally can't be here because they are in the facilities, and speaking from documented incidences that we have read about in these reports that the county has been receiving for the last 8 years. I want to read this so we can level set here. We have heard from credible sources that when a fight breaks out and youth are belly down on the ground in the covered position with their hands behind their heads to show officers that they are not involved in a fight, probation officers have walked up to youth and held OC spray cans in their faces, again while youth are on the ground, and threatened and mocked them that they will be sprayed with OC spray. And those youth, these are the ones that are not causing any problems, not fighting with anyone, laying down on the ground, have been sprayed anyway. There are a number of instances in which the use of the spray is not coordinating, resulting in the deployment of the spray causing the entire room to be filled in a cloud of OC, where all individuals in the room are being affected. And we're talking about safety for everyone. Numerous reports over the years stating that probation officers, not all, but these are the stories being documented. Those that have not attempted to de-escalate a fight, instead wait till the fight has started and then use the spray to break up the fight. So yes, we are talking about, and the focus goes into the ban, but as we have heard, there are some holistic issues that we need to look at, and that is the reason for the subcommittee. And so I wanted to, make sure that I put those on the record in a very clear way, that some of these things are happening in our facilities, and we need to address them as a board in partnership with our employees, our probation officers, our parent groups, our advocacy groups, and CJJA. Thank you.
Supervisor Desmond.
Thank you, Madam Chair. Appreciate it. Once again, this is an ad hoc committee, and I think, particularly after hearing today's comments, this should be a subcommittee that is open. It has to adhere to the Brown Act, is open to the public, so people can come and speak, even though they're not invited, and open and transparent. So again, I don't like the idea of an ad hoc subcommittee. The board, we appoint and we hire the chief probation officer. And is she not here for, I don't know, Ebony, is there any?
She does have representation here.
She does, okay.
Yes, she does.
But, I mean, that's who we hire. That's who we should be directing these problems with and these issues that we hear, and then have her work that out. And if she's not doing a good enough job with that, then we, have to make other decisions. But I think that would be the first step before we do an ad hoc committee, that we go directly to her and say, hey, we're hearing this, and we'd like to see de-escalation of pepper spray. And I also know, in talking to the Probation Officers Association, that we have a recruitment and a retention problem that just only exacerbates the issue. Over 50% of our probation officers are women. And this, unfortunately, the pepper spray is the first line of defense. And it was stated earlier that we have the majority of people are adults that are in the juvie hall. So I can agree with the reduction of the use of OC spray, but not the elimination entirely, and not going into the ad hoc committee with that as a goal. I think we need to better serve our youth, but also we have to protect our officers. And unfortunately, it seems like we always blame the officers first. It's the officers' fault. They're using too much pressure. They're the ones that are at fault when, there's a reason some of these kids and young adults are in there. So we've got to protect both sides of this issue. So I'm supportive of increasing the de-escalation training or whatever we have to do. I don't agree with the initial goal of going into eliminate, because I don't know enough about it. I don't know enough, maybe there's other ways we can try to not use it, have it as a last resort, or have other training. But, and I appreciate, I think it was a while ago, but somebody made the motion about having the Probation Officers Association as part of the conversation. But, well, was it you? Okay. Well, that was a week ago, it seems like. But okay, so I appreciate that. I think that's a great idea, but I'm not going to be supporting another ad hoc committee. I think as supervisors, we got to work with the teams that we have in place and the staff that we have in place first before we do that. Thank you.
Supervisor Paloma-Aguirre.
Thank you, Chair. I'll be quick. I just want to thank the Vice Chair for your leadership on your unwilling commitment on progressive criminal justice reform, and also for bringing this item forward. I definitely look forward to working with you and all of the stakeholders. I also want to thank everyone who came out and gave comment, but especially the parents who are suffering the experiences through their children. I think that the county has a clear responsibility of keeping our facilities safe, trauma-informed, and focused on rehabilitation. And I look forward to the continued work of this the work that the ad hoc is going to do with the probation officers, with the parents, with all the stakeholders that will help inform our recommendations as we move forward, because ultimately that should be the focus of our facilities: safety, rehabilitation, trauma-informed, especially when it comes to de-escalation training, the men training, et cetera. Thank you.
Supervisor Anderson.
I'd just like to start off and thank Monica for considering my feelings and my thoughts. I will be supporting it today. I appreciate, but you can understand that if you already have a predetermined, it's not really best use or best practice. And I think we'll get there. And my goal is that we don't have to have pepper spray, but there are circumstances that will be. I'm glad we're going through the process. Thank you for bringing it forward, and thank you for being open-minded.
Okay, well, thank you very much. We have a motion and a second. Can we call the vote? They're saying more nice things about me.
Chair Lawson-Remer, that motion passes with Supervisor Desmond voting no, all other supervisors being present and voting aye.
Okay, thank you very much. Supervisor Desmond, you have both items 27 and items 28. Those are both your items. They're both legislative agenda items. Would you like to take them both together and you can introduce them both?
I can do that for the sake of expedience.
Go for it. You had a big ledge agenda, so why don't you kick us off on the ledge agenda?
Okay, well, thank you. This is item 27 and 28. So item 27, this is expanding relief for veterans and military families. This is legislation that's before the state. I'll kind of skip to the end here real quick, but both of these bills have become two-year bills. So meaning they're not going to advance this session, but remain eligible to move forward next year. So basically, this is about the cost of living for veterans, and AB 53 seeks to exempt up to $20,000 annually of military retirement pay and survival benefit plan annuities from state personal income tax. California is one of only 5 states that taxes a military retirement pay. And then SB 623 is an amendment that will allow veterans and disabled veterans to claim both the homeowner's exemption and the veteran's exemption on their property. So both of these bills have been presented. Unfortunately, they didn't get out of committee, but hopefully they will next year. I'd like to request my colleagues' support on item 28. This is the one you heard about earlier. I want to thank District Attorney Summer Steffen for working on this legislation and co-docketing this with me. I can't believe these bills have to be written, but elderly parole allows someone to be eligible for parole after serving at least 20 years of their sentence and or turning 50 years old. I understand why elderly parole exists in certain crimes, but right now it covers too many crimes. We're talking about people who have committed sex crimes on children, like rape and sodomy. Even if these criminals aren't released, their eligibility in parole hearings are going to re-traumatize victims and the families. So we heard earlier about this bill being called the Mary Bella's Law that would not allow the babysitter who provided special needs children for her boyfriend to molest gets out of jail early. So that's really what we're trying to accomplish. So those are the two bills, 27 and 28. I'll make a motion to approve item 27 and 28.
Okay, we have a motion and a second. We'll hear from our speakers, and then we'll have an opportunity for board to comment.
Thank you, Chair Lawson-Remer. We have 15 requests to speak on both items 27 and 28, 7 in person and 8 by phone. Also note for the record that we received 3 e-comments on item 27 in support and 3 e-comments on item 28 in support. For any individuals that requested to speak on items 27 and 28 by phone, please dial into the conference line using the instructions that were provided to you. We will begin with the in-person speakers. As your name is called, please come forward and stand on the arrows until it is your turn to speak at the podium. Because there are 10 or more speakers on these items, you'll have 1 minute to address the board. I'd like to invite forward the first 3 speakers, Consuelo, Patrick Espinoza, and allegedly Audra.
How can you mix 2 items that have nothing to do with each other? Give us a minute. What are you guys doing?
There's a question been asked about why these items are being taken together. They're both ledge agenda items introduced by Supervisor Desmond.
But you should give us 2 minutes for 2 items. They're totally different.
There are 15 speakers, so please go ahead.
They're totally different items.
You can go ahead and start her time.
Wow. So yeah, this is what you guys do, and this is ridiculous. Protecting children from sexual abuse, that is BS. You know what you guys do, and I'm surprised Kimsey isn't here. You guys add me to reports and CPS reports and claim that I am coaching a child who reported sexual abuse to me, and an actual individual. Yes, Jim, I'm in CPS reports. And they said, the mother is pushing my propaganda because she's standing up for herself. I am no longer able to advocate for a mother or see children because you guys are allowing your staff to say I'm coaching children. Have you ever looked into the eyes of a 3-year-old who is telling you about somebody who is touching her? Have you? Do you know what that's like? And then to have people bury it by saying she's being coached. You don't protect children. You hide sexual abuse, and you pay people to do it, like Kimsey, who isn't here. This is fucking ridiculous.
Thank you. Next speaker, please.
Good afternoon. Patrick Espinoza. I'm the Chief Deputy District Attorney in the San Diego DA's office. I want to thank Supervisor Desmond for bringing this matter before the board. Since the creation of elderly parole program, California has seen the release on parole of convicted sex offenders decades sooner than their original sentence would otherwise warrant. Originally, the elderly parole program was limited to inmates who were aged 60 years and older and served 25 years incarceration. That was when the California prison population was at 123,000, and the demand was to reduce the prison population. Currently, the prison population is 91,000, and the program has expanded, the elderly program, so that the age is age 50, and the time in custody is 20 years. Under the current program, there are exclusions for many types of violent offenders, but there are no exceptions for violent sex offenders. SB 286 will not repeal the elderly parole program. It will simply seek to narrow the eligibility criteria for elderly parole so that it closely aligns with the eligibility criteria for youth offenders.
Thank you. I'd like to invite forward the remaining speakers in person, David Hansen, Mark, and Ilka Weston.
Yes.
A minute for 2 items. That's just so wrong, and that's sloppy. Very sloppy and disrespectful to the children, the victims, and to the veterans. So let's see, 27, 28. Apart from the fact that veterans tend to be more skilled, prepared to contribute to society, and have earned respect for their service, military retirement pay should, like Social Security payments, not be taxed. Such a racket. And then 28 sounds, yeah, this is, I'm just going to read what, sorry, Paul. Sounds good. As people are generally more active at an older age, it is important that the criminal justice system keep up by not releasing felons and other people who commit serious crimes. I think you should just freaking slice their balls off.
Next speaker, please.
Mark, yes, absolutely. Give veterans a tax break. They've almost died defending our country to make criminals rich in our government. And these are two of the only things I could unequivocally agree with. You should definitely do. Absolutely, we should not have sexual predators that are really violent and dangerous getting out just because they're 50 years old. This is a no-brainer. For once, you guys did a couple of things that are good. It's a miracle.
They got to make you believe in the system. They got to give you a few
Thank you. Next speaker, please.
All by design.
Hi, Ilka Weston.
I'd like to invite forward Ilka Weston, please.
Oh, and I've got 24 seconds left, and I'd like to say what an unbelievable thing it is to put 2 items together and give people a minute on each one. That's just, no, yeah, you're shaking your head. Does that sound like a reasonable amount of time according to the Brown Act to you, Tara? Would you like to try and defend that anywhere in the country? Go to any college, see if they'll believe it. They'll laugh at you.
Well, I will note that you only used half your time for both items, and you did use the other half complaining about the rules. So it does seem the proof is in the pudding. Next speaker.
No, I just didn't disagree with you. It could have taken longer.
Yes, hello. My name is Ilka Weston. I was shortened in my conversation when I called in. Tara, I would appreciate if you don't smile or smicker. I am here in defense of all of these issues. One, I want to compliment our amazing board supervisor, Monica Montgomery Steep, and I want to welcome the wonderful Paloma Aguirre. Joel, go back to school. If you haven't figured out that generational abuse is happening, you don't even look up. You are uneducated. Your own daughter knew about theft at Scripps. You hit a woman in a bar, and you want us to respect you? My son was one of those people that was abused at Polinsky Center. He told me how they were inviting children into the office, and now that he is 18 years of age, I am willing to talk about it. He heard kids crying and screaming and just absolutely.
Thank you. Your time is up. Your time is up. Thank you.
Board member
Your time is up.
Well,
thank you.
Very much. You should hear
care about children as a mother. 79.
Ilka, this is your first warning. I'm sorry.
You love throwing out your warnings. Start acting like a human being and like a mother. Because you're not.
Final call for David Hansen. Not seeing any movement in the chamber. We'll now hear from the individuals that requested to speak by phone. We will start with our first caller.
Call abode. Bella.
Paul, your device might be muted. We'll come back to Paul. Next speaker is Truth. We'll try our next caller.
Okay, can we pause for one moment? Can you pause the caller's time? It seems like we have technical difficulties with our call-in system at this time. So is there another number that people can call?
Absolutely. For those individuals that aren't able to connect, you can dial in, excuse me, to 619-775-1171. That's 619-775-1171.
Say it again.
619-775-1171. Individuals can please dial into that line. 775-1171. All right, we've got our first caller dialing in.
Can you repeat the number one more time?
Yes, it's 619-775-1171.
619.
775-1171.
Okay. I think Paloma's got it.
It's true. 60 seconds is proof in the pudding of 100% disrespect to both veterans and women and children victims of crime. After veterans sacrificed themselves and their families, California has stolen veterans' retirement pay. AB 53's $20,000 exemption doesn't go far enough. The state did not earn a dime of a veteran's compensation and has no right to steal it. Item 28, the state allowing disgusting criminals like pedophiles out of prison just because they turned 50. Criminals do not deserve the empathy that should be afforded to their victims. A victim may not even make it to age 50 due to trauma or injuries. SB 286 and AB 47 don't go far enough. Violent sex offenders and every single convicted criminal needs to stay locked up. I prefer not to have to worry about reoffenders. You know, death penalty is an option too. But we have senators and assembly members that have proven they don't care about women, including public enemy #1 Scott Wiener, the one who pushed the bill where trafficking or selling children ages 16 and 17 results in only a misdemeanor rather than a felony. A society that shields the criminals and criminalizes the victim who would defend themselves is no society at all. And that includes cutting free speech.
Thank you. Now hear from the next caller.
Thank Congratulations, Jim, to show your true colors. When an opportunity to go ahead and speak on items that you supposedly hold dear, you decided to shut down the public's comment to 30 seconds on both items. No. It's not like you really secretly wish that their agendas pass. I mean, we were able to see that when there was only 4 board members, and the fact that you really don't speak up unless if you want to go ahead and boost your name for the congressional race, right? But here's the kicker on that. You're not going to win. You know why? I already looked it up. The guy that you're against has like 90% loyalty to the ACLU. You're like 20 to 30. So, like, yeah, they would rather want that guy. So, you know, the people may want you, and you'll see that in the polls. But, you know, the votes for the other person, those are coming straight from vote by mail, homeless people that the NGOs stole their votes. But you guys want to go in and cover that up, and you want to go in and silence me and pretend I don't exist, correct? I mean, you filed a restraining order, Tara.
Now hear from the next caller.
All about those lessons good as people now are generally more active at an older age. It's important that the criminal justice system keep up by not releasing felons and other people who commit serious crimes too early. As far as protecting children from sexual abuses, you need to focus on improving youth safety at all county facilities where juveniles are held, such as the Polinsky Center, where so many abuses have been recorded. And then there's the school system. I'm sure there are abuses at all of behavioral care facilities and immigrant centers you set up, like adults confined in juvenile facilities and all that stuff. And please stop harassing others. Veterans tend to be more skilled, prepared to contribute to society, and have earned respect for their service. Military retirement pay should, like social.
And church. You forgot church.
And Chair Lawson-Remer, that concludes public comment on this item.
Okay, thank you very much. No one's in the queue, so I'll call myself. First of all, I appreciate Supervisor Desmond, you bringing these items. I think they're both quite important, both in terms of protecting our veterans and protecting our children. I wanted to thank Assemblymember Darshana Patel for her leadership as a co-author on AB 53, one of our local representatives. So I think that's very important to acknowledge, and I appreciate her representing San Diego so well in the Assembly. And I just want to say, very personally on the veterans and military families item, one of my grandfathers is a veteran, Navy vet, fought in the Pacific Theater, was at Pearl Harbor. The other grandfather was killed at Chosin in the Korean War. So I feel very strongly about the importance of standing by our military families, some of whom have made the ultimate sacrifice. So thank you.
Thank you, Chair. I will be supporting both items and appreciate Supervisor Desmond bringing these forward. My district, I want to speak to I think it's item 27. My district has about 44,000 veterans, especially in National City and in Imperial Beach. Imperial Beaches has a very strong partnership with the Navy. Of course, the Navy outlying landing field has been there for decades. So I fully support this item, and I do also want to thank Dr. Darshana Patel for being a principal co-author on this legislation, and I'm just so incredibly grateful for her leadership on this, and hoping that this does bring relief for our veterans that are in such great need, as so many other working families are. Thank you.
Supervisor Anderson.
Thank you, Madam Chair. On a slightly different note, it was pointed out to me that my familiarity with all my colleagues today left some formalities. And Supervisor Montgomery Stepp, I'm sorry, but I feel close to you. I consider you a friend, and I couldn't help but call you Monica because I love you. So, but I want to make sure that I clarified that before anybody walked away and thought they saw something that doesn't exist. And great work, Jim. These are great bills. You know what? I just want to say how much I appreciate you and love you, and that familiarity has really thrown me under the bus today. Perhaps I need to start wearing a tie to remind myself. Thank you, Supervisor Desmond.
Okay. Thank you, Joel. Appreciate you too. Supervisor Montgomery Stepp.
Thank you, Supervisor Desmond, for bringing these items forward, and certainly earlier for the proclamation and kind of explaining and giving that honor this morning to kind of segue into the second item. Was not aware of that loophole, so I appreciate you bringing that forward, you and the district attorney. Also, just a few comments on 27 as well. I think this is the least that we can do with regard to not taxing retirement pay and lowering property tax payments for veterans. My father is a Vietnam War veteran as well, Marine. He would want me to say that. So we kind of grew up a little bit strict, but anyway, I'm appreciative of these items moving forward, and also our very own Assembly Member Darshana Patel from our delegation that was an early principal co-author on this. Hopefully they come out of that suspense file or wherever they are, and they get back on the track for the 2-year track. So thank you very much for bringing these forward.
Okay, with that, we have a motion by Supervisor Desmond, a second by Supervisor Anderson. Please vote.
Chair Lawson-Remer, that motion passes unanimously with all supervisors being present and voting aye.
Okay, thank you very much. We now move on to item number 29. This is the second consideration and adoption of the ordinance to approve amendments to and the sunset of board policies related to economic prosperity and procurement, and adopt an ordinance amending Article 23 of the San Diego County Code of Administrative Ordinance relating to county contracting. Second reading. We have a team presentation. Turn over to the team.
Thank you. If I can start things out, please. Thank you. Good afternoon, Chair Lawson-Remer and members of the board. The county team remains deeply committed to advancing the board's policy priorities and supporting the economic prosperity of all San Diego residents, businesses, community-based organizations, and all of those across our region. The leadership of this board and the direction that you provided to us has been instrumental in ensuring that our practices promote equity, transparency, and inclusive economic growth. This board has long recognized the power of leveraging the county's practices to drive community-centered change, and this is the next step in the suite of policies that have been adopted by your board to advance this work. As a quick reminder of how we got here to the specific economic prosperity work, our focus of today, back in April of 2024, your board directed staff to expand outreach and education to local businesses, explore strategies that were aligned with AB 2019, and identify opportunities to remove barriers to local participation in county contracting. In August of last year, the board further directed staff to further evaluate the use of state and federal business certifications and recommend improvements to local contracting opportunities, including the establishment of small business advancement policies, expanding local preferences, and creating technical and bonding assistance programs. In response, the team, led by our Office of Economic Development and Governmental Affairs, conducted extensive community and stakeholder engagement to validate what we heard in listening sessions with your board and to ensure that the policy proposals brought before your board align with the needs and priorities of the small local business community, nonprofit partners, and the broader public that we serve. This collaboration process helped to refine the recommendations and strengthen the alignment between board direction and community expectations. These foundational efforts not only promote equity and sustainability, but also strengthen our capacity to invest in workforce development and raise labor standards, ensuring that county procurements help create high-quality, resilient jobs for local workers. Before the board today is a policy package that reflects your direction and advances our shared community and board goals. Shaped through cross-departmental collaboration and stakeholder engagement, these amendments mark meaningful progress, but they're not the end. The county team will continue to be committed to innovation and continuous improvement as we carry forward the board's vision and values. To further discuss the specific revisions and recommendations and how we've implemented the changes the board directed during this item's first reading this past June, I'd like to turn over the presentation to a very valued member of our team, Steve Lockett. Steve has been at the forefront of our regional economic development and prosperity initiatives, guiding a multidisciplinary team with strategic vision and bringing deep expertise and strong ties to the business community. His collaborative approach and leadership will be vital as we move into implementation and begin operationalizing these policies to benefit our region. Take it away, Steve.
Thank you, Ebony. As we shared in June, the goal of these policy updates is straightforward but impactful: to increase the number of small local businesses able to and interested in doing business with the county. We aim to leverage our $2.2 billion annual contract spend to achieve a 25% procurement goal with small local businesses, aligning county efforts with California Assembly Bill 2019. But our work is about more than just numbers. It's about job creation, inclusive economic development, and building community wealth. The changes proposed were shaped by community input, and these changes include expanding the definition of a small business under our Small Business Preference Program. This means adding nonprofits, veteran-owned and disabled veteran-owned businesses to the definition, as well as small businesses that are not yet state certified but do meet the state certification definition. We've also launched a reciprocal certification program to reduce administrative burdens for businesses that are already certified by other agencies. These integrated improvements will allow for more small businesses to bid on county contracts. The updated policy also prioritizes local businesses. We are increasing the small local business preference from 5% to 15%, meaning that small local businesses will have their proposed bid evaluated as if it were up to 15% cheaper, helping them better compete with larger companies. We're also looking to expand the use of simpler methods, such as requests for qualifications instead of requests for requests for proposals. RFQs typically take about half the time to complete, making the process faster and less resource intensive for small businesses to participate. Recognizing that economic prosperity and environmental responsibility go hand in hand, updates to the environmentally preferable procurement policy provide clearer guidance for the county to select products and vendors that are environmentally responsible. With the direction provided by your board on June 24th, we are proposing further changes to our small business policy. For the first time, we will formally recognize disadvantaged business enterprises and introduce a new category, social equity enterprise. Let's take a closer look at DBEs. This is a federal designation for small businesses that are at least 51% owned by socially and economically disadvantaged individuals. While California Proposition 209 prohibits preferences based on race, ethnicity, or gender, AB 2019 emphasizes the importance of outreach to and engagement with disadvantaged business enterprises in order to meet our 25% contract spend goal. By aligning our policy with AB 2019, we're not only recognizing DBEs, we're committing to actively engaging with them in our contracting efforts. This is a critical step towards equitable access and opportunity and forwards the county's strategic goal of uplifting all San Diegans. In addition to DBEs, we're proposing to add a new category to further include businesses that can provide services and goods to the county, social equity enterprises, or SEEs. These are for-profit or nonprofit organizations headquartered in areas designated for new market tax credits, areas that have historically faced disinvestment. Utilizing the new market tax credit program and MAP, we are engaging with businesses that are rooted in and dedicated to serving under-resourced communities. Businesses and nonprofits can also be included in our SEE definition in other ways. For example, if they primarily serve low to moderate income populations, justice-involved communities, or advance environmental or climate justice. They may also be included if they donate a portion of their services or revenue to underserved communities, or by being majority owned and operated by individuals from those communities. This innovative approach to small business inclusion is about recognizing businesses and nonprofits that are making a positive impact across our community and encouraging them to do business with the county. So what does this mean in practice? Small local businesses and SEEs under our expanded definition will now all benefit from our local preference program. Their proposals will be evaluated as if they were up to 15% less expensive, making them more competitive for contracts across the county enterprise. They will also be included in subcontracting requirements, ensuring that even when they're not the prime contractor, they will still have access to county opportunities. To ensure that we're making real progress, we're being very mindful to make sure we have a strong data foundation. Since June's board meeting, at the direction of the CAO, a 30, 60, and 90-day action plan has been enacted to assess our current systems. A multidisciplinary team has been defining key metrics and identifying critical system updates. One major enhancement is coming to BINET, our procurement portal. We have enhanced the voluntary, self-identifying demographic information to further align with AB 2019 and help us to better understand who we're reaching. Looking ahead, a data governance working group will oversee trends, refine systems, and develop dashboards to ensure transparency and continuous improvement. As well, we will be producing an annual report to track our enterprise-wide efforts. My apology, we have an annual report to track our policies. Of course, policy updates alone aren't enough. We're also investing in support systems to help small businesses succeed. Our STEP program offers free workshops and one-on-one assistance to help businesses navigate the new changes. We're also launching 2 pilot programs, BUILD, which provides bonding and insurance support, and CORE, which offers bookkeeping and labor compliance training. These programs are designed to reduce barriers, promote long-term sustainability for small businesses, and encourage more first-time county contract applicants. Internally, we know that lasting change requires more than new policies. It requires a culture shift. We're launching a phased rollout to prepare and assist staff across the enterprise. Phase 1 focuses on immediate readiness, updating procedures and training staff by September 25th, when these policies will become effective. Phase 2 updates our contracting officers representative, or CORE, academy materials. And Phase 3 ensures that all procurement documents are aligned and consistent. But we're going beyond just compliance. We're empowering staff to lead and inform this change, strengthening communication, providing support, and identifying ways to embed innovative thinking and equity into our entire procurement policy. In closing, the recommendations before your board today are to adopt the ordinance amending the administrative code, approve amendments approve amendments to and sunsetting of several board policies, and direct an annual report back on our outcomes. This concludes our presentation, and staff are available for any questions you may have.
Thank you very much. Any questions from any of my colleagues? Okay. We will go to public comment, and then we'll have comments from the board.
Thank you, Chair Lawson-Remer. We have 7 requests to speak on this item, 4 in person and 3 requesting to speak by phone. Also note for the record that we did not receive any e-comments on this item. For any individuals that requested to speak on this item by phone, if you could dial into our alternate call-in system at 619-775-1171, and we'll hear from you through that system. We'll begin with the in-person speakers. As your name is called, please come forward. I'd like to invite forward Consuelo, allegedly Audra, Mark, and Ilka Weston. You'll have 2 minutes to address the board.
Looks like I have 2 minutes, so I want to call out the board for breaking legislation. You cannot combine two conflicting agendas. One is dealing with our youth. The other is dealing with our service members. It clearly says right here, and in fact mentions San Diego, if a board attempts to combine two truly conflicting items where passing one would negate to make the other possible, it could face several challenges. Breaking the Brown Act violation, demand, cure, and correct, supervisor conflict of interest. So I encourage you to step back and understand that we have bothered to educate ourselves on the law. So if we know the law, we are asking you to go back to agenda number 87, not 87, sorry about that, 27. And why is our legal incapable of looking up this information? Would you like to see it? Where are you? Would you like to see it? Why did you allow it to be combined? I can't see. Honestly, I should be home right now with this on, but I had a rush down here when I was conflicted when I was talking. You cannot combine two issues, so we are requesting that you go back to 27 and deal with it as an independent agenda. It is breaking the Brown Act. Do your homework if you're a lawyer.
You guys know it too. Yep. Streets, you know it. County council should be telling you guys too. You're right.
So you guys aren't? You're going to break the law? And Desmond, stop lying about helping Tijuana River. You are not. And Trump is never going to kiss your butt. So very clearly, who made the decision to break the Brown Act and combine something having to do with our law? Oh, it was Jim. Our service members and our youth. They are conflicting. Oh, always Tara. I don't even understand how you think you're a Democrat.
Okay, thank you very much. County Council David Smith, could you please address the concerns raised by our commenter?
Oh, that guy. Okay, I'm sorry.
Okay, Ilka, this is now your second. I'm going to ask you to leave.
Stop doing this.
Sheriff, this is her second. She had a first warning.
I offer to show that is not breaking the rules.
You can either sit down or you can leave.
I will sit down, but you need to
Okay, sit down now. If you keep talking, you're going to leave the meeting.
And this is how you break the law. This is how you break the law.
Okay.
It's breaking the Brown Act, and
Sheriff.
you are criminalizing me now.
Okay, this meeting, we will pause until Ilka leaves the meeting. And David Smith, you can go ahead and answer her question, but first she needs to leave.
Well, then I get to talk on it, because those are the two issues I wanted to talk on. I should be at home taking care of my heart. But because of your fat failure of following through with the law, this is the Brown Act, and you're trying to throw me out because I've just called you out for breaking the law.
Do we need to take a recess?
You better not put his hands on her.
Okay, we're going to take a 5-minute recess.
I just called you out for breaking the law. And
Smith to explain the rules on combining items in the Brown Act.
Chair Lawson, members of the Board of Supervisors, the issue that was raised was that the two provisions were conflicting and therefore could not be voted on at the same time. In fact, there's nothing inconsistent about the two the two board letters and the requested actions, and that therefore there was no issue with combining them, and it was legal to do so.
Okay, thank you very much for the clarification. Did we have additional speakers on this item? Yep. Okay, thank you.
Thank you. I'd like to recall Consuelo, allegedly Audra, and Mark.
Monica, what do you mean by I better watch myself? Is that a threat? Is that a threat? No, it's not, but I just better watch myself, right? Right. Better watch out. Right? Just like CPS going into other families and saying, do you know Audra Morgan? What have you told her? Huh? Is something going to come down the pipe? At least I know if you guys get rid of me for exposing you guys as child traffickers, I'm going to go straight to paradise. You guys are going to go straight to hell. It's interesting. I mean, I guess we are in hell, right? It'll be reminiscent of this. You guys will just be alone, sitting there begging and pleading. Right? Like you see everybody up here, it'll be probably reminiscent of this, and you'll be like, please help me, and they'll be like, oh my gosh, we're not going to do anything, we're just going to pretend, and then we're going to threaten you and say, you better watch out. You better watch out. I got that on tape, Monica, even though you guys didn't have it. It's fine. I know. And then when something happens, we know who did it, right? No. But if I did that to you, right? I might be arrested. Maybe I'll be assaulted again. Right? You guys actually care about people, right? You care more about your feelings. You need to apologize. You said a bad word. Oh my gosh. But it's like, you guys don't care. Yeah, you didn't care about it at city council, Monica, when they were calling you an Afro puff. You were like, I don't really care what people call me. But then all of a sudden now you do, and you want an apology, and then you get a little standing ovation practically. We get a clap now, right? And then you tell people, watch out. Watch out. What does that mean, Monica? Watch out. Watch out. You guys love to threaten people. It's interesting. It's so cool. So cool. Your God is Satan.
Next speaker, please.
Love you, Monica. She's such a good.
Mark, so everyone needs to see these YouTube videos. The thing about this is small businesses that go along with the United Nations agenda goals tend to get more contracts, of course. And if people don't believe this is real and it's happening, see these YouTube video titles. Here's Klaus Schwab. In 1 minute, he says straight out that he's penetrated governments. Trudeau's there in the video. He mentions Macron. And Governor Newsom is a young global leader for the World Economic Forum. In this video, at 5 minutes and 28 seconds, they'll quote for you the following. The United Nations and World Economic Forum signed a strategic partnership framework in 2019. On September 22nd, 2020, the United Nations General Assembly announced that China would be tasked with collating all the world's data on human movement and activity. It is called GEOINT. China's richest man, Jack Ma, with Melinda Gates, are heading up the UN's Digital Cooperation Program, bringing all the personal data of all people in the world into one central place. Now, since that's all, you can look at that, it's proven, it's real. He's saying it, they're doing it, they're not denying it. Here's a video you might all want to see then on YouTube about Agenda 21. Here's another one. These are all YouTube titles, they're free. Please look at them. Here's Sandag at 1 hour and 22 minutes and 50 seconds. They're openly trying to limit your driving and get you out of your cars against your will. Rosa Corey, a California expert on land use and property valuation for the Department of Transportation, talks about this in front of the New Hampshire legislature. There's the title and some times for parts 1 and 2. And consent and discussion items, by definition, they can't mix. Consent is many.
Thank you. Thank you. Thank you, Mark. Next speaker, please.
You ever understand?
Next speaker, please.
How could you even, say...
Mark.
Okay, Mark, please, your time is up.
Oh, well, you just lied. It's not possible.
They always lie.
By definition, one has multiple, the other is single.
Okay, this is your first warning. It's your first warning of the day, so. Oh, it's the second. Mark, I'm sorry, I'm going to have to ask you to leave. It was your second warning.
Well,
Apologies, I've been told by county council, by Andrew, he's keeping track. It was your second warning.
yeah, well, you know what? A discussion item is not multi, that's consent. That is the difference. It's why they're placed in different sections. It's important that these are discussed separately and voted on separately. That's why you do it, right? And could there be any difference on that? You're just full of shit. And everyone knows it.
Go ahead, Consuelo.
Okay. So, good job, Mark. And small businesses doing well do not be in partnership with the county, and the county needs to leave them alone. Big government, big problems. It's also disgusting witnessing what goes on here. It's gross. It reeks of UN Agenda 21, actually. This board is full of such weasels working for their own climb at the political ladder. And yeah, just like I said, small businesses are now the target because it's all about big government. Yeah, I didn't have much to say about this item. Now that I have 2 minutes, it's gross. The way this board operates, it's gross. The way the people are constantly being silenced, and you guys just don't give a shit. Shit. You don't give a shit. Don't give a shit. You don't give a shit. You don't care. You don't give a shit. Shit. Thank you for looking up, finally.
We'll now hear from the individuals that requested to speak by phone. We'll begin with our first caller.
Can you remind me what happened when Nora said basically the same thing I did? What did the county do? Curiosity. Did they pay for like $42,000? And why did she say that? I mean, she was talking to one of her stakeholders, right? She was talking about her stakeholders. I mean, and why was that released? Oh, yeah, they wanted Cindy Chavez, right? Instead of Ebony. Well, she did not buy into all of the ACLU tendencies. She was a little bit more San Diego. I like her, even though she and I disagreed. So what are you going to do about me, huh? What, you're going to use that as an excuse to terminate any kind of conversation with me? I mean, Tara, I have a 20-minute conversation where you promised you were going to look into vote by mail. What happened about that? I know what happened. I received a restraining order. That was just you checking a box saying that you talked to me. Wasn't it? But your name isn't on the restraining order. So I have the right to continue to go ahead and call you and demand these questions. And you have, and I'm waiting still way past 10 days for an answer. When am I going to get that answer from you? By law, I'm supposed to wait 10 days. I have it on recording that you and your staff was going to look into it. Did you? Or did you look for ways to silence me, violating an election law? Do you know what election law, lawyer? It's in the 18560 block. So that is what my whole goal is, and that is why I went with Hermes. That was a stunt. I'm glad you guys took the bait. And I was able to show the fact that that Monica is actually racist. She doesn't want to go in and support Jamal Brown because he's...
Thank you. For the record, that speaker is Gambler Hermes. We'll hear from the next caller.
Paul Bold. Nice sweet-talking presentation, faster processes, less thinking and analysis. There are too many objectionable things in this ordinance. It could lead to too much fraud, waste, and abuse. You probably don't care about that, but some of us do. Most of us do, actually. With an unresolved reserve deficit and budgetary funding shortfalls or even clawbacks expected, it is not a good time at all to spend an estimated $1.3 billion on expanding some board policy A53. The 25% increase the Director of Processing and Contracting can make without your permission under the SD County Code Section 401C is way too much. There needs to be a dollar limit as well as a percentage. Otherwise, you'll probably end up wasting the money you plan to get from the emergency reserves. And there are way too many exemptions for competitive procurement. Utility, educational, standard off-the-shelf software, operating and maintenance for software, medical equipment, use and subscriptions, goods and services just for the CAO and board. It sounds fraudulent, by the way. I mean, it sounds like sole source contracts, and we know how they go. And I'm referring to policy 87 and attachment G.
Thank you, Chair Lawson-Remer. That concludes public comment on this item.
Okay, thank you very much. We'll call in my colleague, Supervisor Montgomery Stepp.
I just want to say thank you. Thank you. There's been a lot of work that has gone into this and a lot of back and forth trying to make it work and really meet its intent, which is for us to have a broader reach to more people in our community that are owners of small businesses or operators of nonprofits. So I really look forward to the progress that we'll make and continue towards the county's 25% small business spend goal. It's very important to identify DBEs, and with the data that we're looking to collect, we can hone in on our outreach efforts to get these small and local businesses to participate in county procurements. Appreciate also adding the social equity enterprise category. I think, so many people that will be in need of technical assistance and doing business with the county. It's a huge umbrella that they can get under for those additional services if we continue to monitor this and do this right. So I do appreciate the work, and I do believe there are recommendations that I will move at this time. Thank you.
Okay, we have a motion by Supervisor Montgomery Stepp. I also want to echo, appreciate all the work. I know it's been a journey, and I think we're in a much better place. I do know we have more work to do kind of in terms of our procurement and contracting and leases, and I know that's underway on various aspects, but this I think was an important step in the right direction on a key set of issues. I think the only, I guess I'm going to say to the comment and then sort of invite a response or a reaction. One of the pieces I really appreciated was the report backs on the monitoring of progress. How do you intend to identify where we're failing or falling short, or sort of where it's not working as intended? I want to kind of be explicit about that because I think it's easy to think about a progress report back as only highlighting the progress and potentially not being completely holistic in an assessment that then would identify where the work we're doing is not actually achieving the results that we would hope to achieve. So I was hoping you could talk a little bit about how you can put together like a framework for evaluation and assessment and report back that doesn't just sort of like report back the successes, but also looks holistically and looks at, as we like to see, not just the pluses, but also the deltas and the room for growth. Thank you.
Thank you, Madam Chair, for the question. That is definitely something that we're very mindful of at this time as we're building this new data substructure. We're really looking at utilizing this next year as our new baseline data that we will be tracking in terms of those that we do outreach to, those that are in our BINET system, those that get our contracting. We have expanded the amount of data that we are trying to get from those who are fit under all those categories. And with our goal of 25% for small business, that is definitely our target. But as you say, we want to make sure that what we're doing is being impactful. So over the course of the next year, we are going to be tracking our outreach, our engagement, those who go through our system, sign up in BINET, get contracts. And next year, next September, when we come back and present that, we will be forthright, transparent, honest about how well we've done, see if there are avenues that we need to expand on, avenues that we may need to change in terms of outreach or engagement, and see where we may have some gaps. And I think the really great thing about this new data system that we're setting up is that we are establishing metrics that will fit across the entire enterprise and that we can track across, again, outreach, engagement, and procurement. And so we are very mindful that we probably won't hit that 25% goal immediately, but we do believe that we're going to show really good improvement over this next year. And when we come back, we will show you where there are still some gaps, and we will happily discuss ways that we can improve that and ways we can change as we move forward.
Okay, that's great to hear. Yeah, I think if you all come back and say, and only tell us how great we're doing, I'm going to think what the report's hooey. I don't know what the slang frame would be, but I do think it's really important to acknowledge that we're always going to be doing the work, and there's always going to be room to do it better, especially when we try something new. And I'm really interested in, where we're not kind of hitting what we want to be hitting, and how do we improve, and how do we cover those gaps. So that's going to be the thing I'm most interested in. So thank you, and I'm happy to second. Any other additional speakers on this item? Okay, with that, we have a motion and we have a second. Please vote.
Chair Lawson-Remer, that motion passes unanimously with all supervisors being present and voting aye.
Okay, we now move to item 30, the County of San Diego and San Diego County School District's Tax and Revenue Anticipation Note Program, Series 2025A. Turn over to the team.
Thank you, Chair Lawson-Remer. This item before you today is a request to adopt a resolution authorizing the borrowing of funds by school districts within the county in accordance with Government Code Article 2, which is the deposit of funds, Section 53635.7. This section requires that such matters be considered as a separate item of business on the agenda. To manage short-term cash flow needs, local governments, including the county, will issue short-term tax and revenue anticipation notes, or TRANs. While the county's own TRANs for fiscal year 25 were successfully issued and closed on July 3rd, 2025, the county is now facilitating the issuance of the 2025A series TRANs on behalf of participating school districts that have requested such support. Repayment of the notes will be the responsibility of the participating school districts. At this time, there are anticipated to be 2 participant school districts borrowing an aggregate amount not to exceed $120 million. Subject to questions, this concludes the comments.
Any questions from my colleagues?
Move to approve.
We have a motion by Supervisor Desmond. Any second?
I'll second.
Okay, a second from Supervisor Aguirre. Please call our commenters.
Thank you, Chair Lawson-Remer. We have 4 requests to speak on this item, 2 in person and 2 by phone. For those that requested to speak by phone, please dial into the conference line using the instructions that were provided to you. I'd like to invite forward allegedly Audra and Consuelo.
Better watch out, yeah. Interesting. So yeah, schools should be shut down because they are trafficking centers and indoctrination centers, places where children can go, basically be taken from their parents if their parents don't want to, have them chop off their penis or their boobs or whatever. It's interesting because Zaya right here, 2-year-old, right? The Robinson girl, is being force vaccinated by Alex Calero so that she can go to school. a 2-year-old, go to school. She doesn't go to school, but they're attempting to force vaccinate her against her parents' will, but that's okay because whatever the county decides they do, as long as you capitulate, right, Monica? Do whatever the county says and you'll get your kids back. It's so funny. And then I think about AB 495. It's interesting when things can be used for good. It's sad, though, because there's a lot of parents that could potentially drop their children off at school and you know what, come back and they're gone because somebody said, I'm going to be a caregiver for you. But you know what it does? It allows all the children that you guys kidnapped to be taken back and given back to their parents. How cool is that? To take a bus, go to all of the schools, put in some kind of affidavit to be a caregiver, right? And return all of those children home. No, Jim? Right? Because that wouldn't be right. We have to abuse them. Bet you if it was your child, you'd do anything in your power to get them back. Maybe. I don't know. You do sell out for money. So I'm sure if somebody passed you some money, you'd be like, screw it, just leave them in Polinsky. It's cool. Right? It's interesting the things you guys do and then threaten people. You better watch out. You better watch out. Looks like you guys all better watch out. Is that a threat? Oh my gosh. Right? Yeah.
Next speaker, please. Consuelo, you're the next speaker. Okay, thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Yeah, hi. I think you know me. Looks good. Speak of learning, though, I would like to learn why this meeting was so acrimonious. So many people ejected or threatened. Is this really only the audience, or are you egging them on in some way? Maybe you're more sensitive on some days. I mean, that's a common human failing, but most of us can kind of control it. In the past, I've also seen you apply rules arbitrarily. Is this happening again? And I sure hope everyone's obeying the Brown Act. I mean, I've seen that violated a few times, too. Anyway, that's about all I have to say on this education subject for now, except I hope you clean up the schools so the kids don't get taken away or their rights violated in some way. Anyway, thanks for hearing me.
Thank you. Now hear from the next caller.
You know, I want to go ahead and just point out the fact that I regret the fact that I had to get that nasty in order for me to get your attention. But if you've noticed, after that, I haven't really cursed, haven't I? Right? Completely, utterly relaxed. Why? Because you're actually paying attention to what I have to say. I know this because you and the lawyer, Tara, were discussing about that whole issue with the fact that you haven't answered my question yet. And you're hiding behind the restraining order not to answer it, which is a violation of election law. So A, do what you said you were going to do, recognize that I am a living human being, and stop treating me like the house. You get what I'm saying, Monica? So if you're going ahead and crying, oh, that's bullshit. Where were you when Nora said it? Nowhere? Oh, no, you went ahead and tried to defend her on it, right? That's right. All that was just a political stunt that is going to land me in the newspaper again, and I'm going to have to talk to a lot of people because of how you guys were treating me. More stress, more that, and when this gets discovered, whistleblower activities. Go ahead and do the investigation if I win. and figure out how much money I would end up getting if you forced me into it. Do you understand? I haven't gone after you at all. You have gone after me, and that is it. I have not gone after you. I've been asking you to go ahead and answer my questions and try to secure these elections. But each and every one of you, including you, Jim, want to go ahead and ignore me. That's why you pulled that little stunt, Jim, to go ahead and divide the people and make this more of a circus show because you didn't really want to.
Thank you. And Chair Lawson-Remer, that concludes public comment on this item.
Okay, thank you very much. We have a motion by Supervisor Desmond, a second by Supervisor Geary. Any comments or questions from my colleagues? Okay, please go ahead and vote.
Chair Lawson-Remer, that motion passes unanimously with all supervisors being present and voting aye.
Okay, thank you very much. We now have an opportunity for board committee updates, including ad hoc subcommittees. If anyone has any updates. Anyone would like to share? Okay, thank you very much. We now move to non-agenda public comment.
Thank you, Chair Lawson-Remer. We have 11 remaining requests to speak on matters not listed on the agenda, 3 in person and 8 requesting to speak by phone. For any individual that requested to speak by phone, please dial into the conference line by calling 619-775-1171, and we'll show that phone number on the screen. We'll begin with the in-person speakers. I'd like to invite forward Marina Boom, Alicia Morrison, Layla Allison, and David Hansen. If I've called your name, please come forward. You'll have 2 minutes to address the board, and I'll ask you to please state your name for the audio record.
Alicia Morrison for the record. Per policy I-1, the unincorporated community of Lincoln Acres is seeking formation of a community-sponsored planning group designation from this Board of Supervisors. It is vital for this disadvantaged unincorporated community to have linkage with the county on matters dealing with the planning and land use. History has proven that our disadvantaged unincorporated community has been without a voice on matters relating to annexations and development that has negatively impacted our neighborhoods. 2 minutes. Lincoln Acres has a great need for this. For example, late last year, there was an irresponsible development that was proposed in an adjacent incorporated community. An established residential neighborhood and an unincorporated community of Lincoln Acres worked together to oppose a public health nuisance project. We need this established, this linkage, so Lincoln Acres will have a voice as the general plan states in LU 1.5. Relationship of county land use designation with the adjoining jurisdictions. LU 4.5, annexations with incompatible land uses. Coordinate with LAFCO to oppose annexations by neighboring cities that would result in land use incompatibility with unincorporated lands. Currently, there are 2 community planning groups in District 1, the Sweetwater Community Planning Group and the Spring Valley Community Planning Group. Approving this formation of the community sponsor group for Lincoln Acres will provide the residents with badly needed linkage with the county on matters dealing with planning use. I will leave my information with the clerk, and I hope to hear from Supervisor Aguirre. Thank you.
Thank you. Next speaker, please. Final call for Marina Boom, Layla Allison, and David Hansen. Not seeing any movement in the chamber. We'll now hear from the individuals that requested to speak by phone. We'll start with the first caller.
Ricky Robinson. I've been waiting all morning since before 9 o'clock to speak. I'm Ricky Robinson, the paternal grandfather of the stolen girls you're traumatizing here. Please say their name, Malika and Zaya Robinson. Malaya and Zaya Robinson. I had to relocate my mother, my 88 dependent mother because you guys are after me with a restraining order, and to put a restraining order between me and my grandchildren because you retaliated for us speaking out at the Board of Supervisors June 24th. You've been treating us inhumanely, dehumanizing us. This is sick. FreeKeenan.com. Just go to the website. You can watch the trauma videos. You can see it all. You can see the surveillance to social workers typing on laptops, following the mother with her toddlers, diaper changes, bathroom potty time, typing on phones, peeking through the crack of the bathroom, all because she spoke up. We're exposing a predator, David Miller, and Norma Alvarez, trying to steal our children. We have recordings, and we're protected under, I believe it's, I forgot the number right now. Anyway, I've sent recordings to journalists, activists, some civil rights attorneys across the states. When these recordings get out, David Miller, you're toast the way you treated us. Nicole Montezego, we're taking you down. You messed with the wrong family. You stole the wrong children. And Jessica Nicole Bellman, you better keep your dirty needles away from my granddaughters.
Thank you. We'll now hear from the next caller.
Good afternoon. My name is Terry Ann Skelly. I'm a parent and a public health educator. I came this afternoon because I feel that our county has been much involved in financial decisions regarding procedures and policies and practices that affect how our residents live and recreate. For example, every county resident, regardless of their financial or living situation, should benefit equally from clean air. The best way to achieve this is for every citizen to live and play in smoke-free and vape-free environments. The Surgeon General recommends two major strategies to effectively eliminate tobacco-related disease and death while addressing disparities in neighborhood services and facilities and amenities that sometimes happen here in our cities. And they are, number one, adopt smoke-free and vape-free policies for housing and public places, and number two, make smoking and vaping products less appealing and available. The Surgeon General has made it clear what the pathways are to improving the health of our most vulnerable populations. Let's begin the process now to implement smoke-free and vape-free policies for public places and apartment complexes. And now is the time for our Board of Supervisors to hold the course. No more stores that sell or enable the use of tobacco, marijuana, or CBD smoking and vaping products here in our county. Thank you for hearing my concerns this late afternoon.
Thank you. We'll now hear from the next caller.
Hey, it's Truth. I appreciate that the oath of office was finally inclusively open to all residents who funded it, rather than exclusive like past oath events. But honestly, the sea of purple shirts was disgusting, and most of the credit-stealing oath speech was almost like Poser Paloma hijacked Nora's real immigrant story, pretending as if it was her own. I certainly never heard Presente in Imperial Beach. By the way, Paloma, about the new red warning signs for the CRV, IB needs more signs like it needs more studies. If Mexico's sewage air is so dangerous, why did you vote twice to not hold Mexico accountable? Paloma doesn't even want people from Imperial Beach to get an air purifier, evidenced by her recommendation at APCD that there be zero address verification on who gets one. No wonder they're up for sale in Marketplace and offer up. Next, so long to sellout Sylvia, who got a bonus to shut up and run. The La Prensa article entitled County Supervisors Force Top Lawyer to Retire exposed a lot. Just like I said, corrupt Queens, Nathan and Lorena, the political unions, have been pulling the strings here since 2020. That's why there was a Cindy Chavez scandal where Nora first came under attack by her fellow Democrats, and why Paloma now has leftover Worley trash as her chief of staff. Nora 2.0 Paloma has no idea the level of real sewage she's been dragged into by Tara. Former CAO Helen's email to former counsel Claudia on December 6, 2023 read, quote, I am very upset by a phone call I received from Tara. She went on to say that Michael was not a shoo-in. However, she would vote for him as an interim to ensure there were 3 votes if he agreed to make Paul Worley the assistant CAO. She asked me to ensure Michael would name Paul as his number 2. This egregious quid pro quo backroom deal and interference is a blatant attempt to involve me in an unethical scheme. Paul told me he had talked to Tara about this. I told her no. If anyone found out that she had cut a deal like this, it would look like she was trying to insert her self-chosen Politico, end quote. How convenient that Helen, Michael, and Claudia are all gone now. A federal investigation is definitely needed. So much corruption in only 2 minutes. Shame on these supervisors pushing a corrupt system. Wait till it goes to 11:30 at night.
Thank you. Now hear from the next caller.
Barbara Gordon. I wanted to share with you the good news. Our own San Diego Dr. Ronit Lev, he's an emergency medicine doctor at Scripps Mercy Hospital, will be joining the White House Office of National Drug Control Policy, ONDCP. Dr. Lev has spoken and written extensively about her issues with marijuana and what she and the other doctors saw daily in her ER room, describing it as an understated public health risk and arguing that commercial interests are the driving force behind these health problems. Dr. Lev said, when it comes to marijuana, the harms are right in front of our eyes, but we ignore the data and follow the industry's talking points, just like we did with OxyContin days. We need to learn from history, she said. And would we want big tobacco to be in charge of the rules and marketing of the nicotine potency? Would we want Purdue Pharma to be in charge of the opioid overprescribing? And if not, why are we allowing big marijuana to control the rules and regulations on public health? Dr. Lev said that it is an insult to our profession, doctor's profession, to call marijuana medical. I urge the county to listen to Dr. Lev. Given the troubling rise in marijuana use and abuse it has on the community and young people. Thank you for letting me speak.
Thank you. Now hear from the next caller.
Hello, this is Kelly McCormick. I'm a public health educator with a focus on youth drug prevention. Last week, I attended a training on youth marijuana use trends provided by one of the county's premier substance use disorder treatment providers and the San Diego County Sheriff's Department. Interviews with teens are revealing that young marijuana users are starting with 70 to 85% THC vapes on their first use. As you know, this is highly concentrated and far higher in THC than merely smoking a joint, especially one compared to 20, 30 years ago when they were maybe 3 or 4% THC. Now, THC on their first use. So this is having an important and alarming effect on their mental health development and their brain development. And also these interviews show that youth tend to smoke marijuana before taking part in activities. And think about what the effect is having on their development. If they're getting high on a regular basis, how do they learn to deal with fear, anger, sadness, or boredom? They don't. There is treatment available, but it often takes 8 to 10 episodes of being caught, getting in trouble, difficulty in school, et cetera, before they even begin to think about treatment. And even so, it is sometimes hard to come by and sometimes not affordable for many families. It's best when it's individualized and done along with cognitive behavioral therapy and other proven techniques. So it takes a very individualized and direct approach to help kids deal with these problems. Just wanted you to be aware of that. Thank you.
Thank you. And Chair Lawson-Remer, that concludes the request for non-agenda public communication today.
Okay, thank you very much. We do have one adjournment in memory today, which will be presented by Supervisor Desmond in memory of Noah Tobin.
Thank you, Madam Chair. Appreciate it. This is an adjournment in memory of Noah Tobin. So, Petty Officer, second class, Noah Tobin, he died during a parachute training accident on July 1st. He was 23 years old. Tobin, originally from Valley Center, joined the Navy in 2021 and became a special warfare combatant crewman in 2023 and was part of the Special Boat Team 20 based in Virginia. His return home was marked by beautiful and powerful tributes. Navy teammates, family, Escondido police and dignitaries, and local fire agencies from across North San Diego County participated. Fire units lined every overpass on Highway 15 from the county line to Escondido. This is how we honor Noah's sacrifice, said Valley Center Fire Chief Joe Napier. He lived with purpose, humility, and deep love for his family, community, and country. He aimed for making a difference, and his favorite words were go big or go home. Tobin served our nation with dedication and honor, and we recognize the profound loss felt by the Tobin family, friends, and his fellow service members. In Tobin's memory, we adjourn today's meeting with deep respect and gratitude for his service, and may his commitment to duty, his country continue to inspire us all. May this young man rest in peace.
Thank you. Okay. With that, this meeting is adjourned until tomorrow at 9 a.m.
This meeting is in recess until Wednesday, August 27, 2025 at 9 a.m. for the land use legislative session.